All right, so since we now have nobody signed up to speak, we'll go on to agenda item number 4. We're going to discuss Texco and district retirement system plan to take action if necessary.
So I spoke to the rep, Christina Fox. I told her she did not need to attend because she was giving the exacting presentation at 8.
I didn't get to go. Did you get to
Y'all didn't go to the presentation?
No, I was in with
I would ask that you table it.
Okay. I make a motion to table that item, sir. Second.
Got a motion in a second. All in favor, say aye.
Aye.
Item number 5. Sports Day.
Hey. I'm trying to do like y'all and be paperless. Bear with me. The month of January was a busy month. The report I sent in, I sent to Jason. I don't know if he got that distributed to you guys or through the email.
Yesterday I forwarded it to the board.
Thank you, sir. I'll give you an update, just an FYI. The report that I sent you, typically what I do when I get all the data is I go through the report and I look for any kind of response times that are out of whack. Because what happens when, in the EMS world and any other first responder world, all your times are tracked by somebody. Our data comes right off the patient care report, and sometimes dispatch hears the guys, sometimes they don't. So typically what I find is when I see a response time that looks out of whack, like 30 minutes, you know that's not accurate unless they're coming from the north side of San Antonio. So I'll go to the GPS and look for that, but I have to have the bumper number to the truck to track the GPS. On January the 1st, our company moved from TraumaSoft to a new software, new to us, called ESO. ESO software is new to pull down reports. It pulls down reports on trucks, but it didn't give me the bumper number. So therefore I couldn't GPS any of the report items that were over the time span. Having said that, all of the averages still came out very well. Hopefully this problem will be resolved in the next few weeks, and I'll be able to get those reports with the bumper number, and I'll update the report that you have now once I go through the GPS and update those numbers. So what you have right now is a rough draft. But even at that, the overall response times look good.
Did you talk to the team that was assigned that?
Sir?
Did you talk to the team that was assigned that it was on that call to find out what they?
Oh no, there's more than one. Okay. I mean, there were several calls.
One was 30 minutes. So.
Well, one was 30, and I hadn't had a chance to talk to anybody. But so I don't know. But I'm just letting you know. Historically, that's the process I go through because the GPS doesn't lie. You know what I mean?
Sure.
When I look at that, I know exactly where the truck was at what time, and saves me from having to call 20 people or whatever. I was hoping to get that data pulled out, but we haven't been able to do that yet. We're still being trained on the new software. So, as far as the total number of calls, it's 214 for the month, which again is a high number. I'm going to refer to the last pages of the report because they kind of get to the point. For Atascosa County, we didn't have any. For the city of Lytle, we went 3 times during the month. City of Devine, we responded to 59 calls. And the city of Natalia, 25. We went to Frio County once. And then Medina County, or the unincorporated areas of the district, we went to 126. So response times to Lytle was 11 minutes. Response times in the city of Devine averaged, when I took out the zeros, as you had been requested from your financial guy, they came in at 4.4 minutes as a response time to calls average. City of Natalia at 5.3, and within the Medina County area it was 8.9. So everything came out well within the 9-minute requested response time. Those will obviously improve when I get the GPS data, I hope. But all in all, the numbers look pretty good. No major issues that I'm aware of during the month. I think we've had one unit that's gone out of service. We've put another unit back into service. As far as I know, everything else is going fairly well.
11-minute response time to Lytle. Do you know offhand, was that day or night?
Where what?
Was that a daytime or nighttime? Do you know?
No. But I do know it was from Devine.
They were here. Okay.
Yeah. Now, when I say Lytle, that means officially within the city limits of Lytle.
Sure.
Everything else we just consider Medina County because as the report shows you, your district goes into the postal zones of Lytle, but that is in Medina County.
Sure. I was just curious if it was when the crew was here at night versus...
I can find out. That's a piece of cake if you want to know that info. Let me know.
While we're on that subject, Pat,
Yes, sir.
there's a portion of Lytle that the city of Lytle in Medina County, they opted out of the ESD. Do you know if we're covering that area?
We
don't.
when I say we, the ESD gave up a portion of the Medina County area.
Right, because it was in the city limits and they didn't want to be in the ESD.
Yeah, whatever.
Right.
I don't remember all the rationale, but yeah, that was pretty much it. When we get called, it's usually because the unit Lytle is either on a call or unavailable. So, it's, what do you call it? Excuse me for having a mutual aid.
Yes, sir.
And then the other thing that I wasn't able to track this month because of the bumper number issue was mutual aid calls. I couldn't get that. I do know that on the average, when I talk to their director, they're coming over here at least 7 times a month into your district. And I can only assume that number didn't go down if we had 214 calls. That usually, the higher call volume, the more often you may have to call on mutual aid. I did look, and I didn't see any of the Castroville units that made it down here, but again, without the bumper number, I'm not sure. But your units, the units that we have assigned here, responded to 214 911 calls.
Any other questions?
Theory as to why we had such an uptick. Was it because we had cold in there?
Flu season.
Flu
season.
Okay.
We had a lot of flu-like symptoms last month.
The call volume, typically, historically, if you look at like the last 5 years, you can almost see that pattern. As you go into the summer months, you have less sick. You might pick a few more accidents, but, typically between November and March, you're going to peak, and then it starts going back down again.
And it is something that industry-wide hospitals look at the same trends.
Okay. Yeah. So it's just not out of the norm.
No,
that's
not for the time of year.
Right. Typically, I think the highest month that we've ever had was 218, maybe 220, but that's rare. The average is always right around the 200 number or less. So when COVID struck, we had some high numbers.
Okay.
A lot of repeats. But since COVID, got under control, those numbers came back down to what they were pre-COVID.
So I have a question for both of y'all.
Yes, sir.
Jason.
Yes.
So your crews have decided that they wanted to go 4 days on and 4 days off.
72.
Yes. 72.
Yeah.
My concern as a previous paramedic is at 214 calls, we're running an average of 4 calls a day. And I don't know how many of those are after midnight. I really want y'all to watch your crews because I'm concerned for them and I'm concerned for patient care if they're working 72 hours straight. That's a crazy schedule. I don't know where that came from. I know they're happy with it with all the overtime, but it really concerns me for their health. We run it 4 days on.
It is something that I check in with them every week. In fact, almost daily, I ask the crews, hey, were you busy? I get the call logs at night. I know exactly how many calls and which truck's been assigned. But if they're tired and I can look at the calls and say, you were busy, go get some rest, right? That's pretty well regulated. If it's something where, oh man, we are just super busy and we're tired all the time, it's like, but you didn't have any calls last night, so you chose to stay awake all night, or you chose to play video games, or whatever they want to do. That's different. It is something that we have observed in the last month, maybe, that we've been on 72s.
Yeah.
I've had to send one person to go nap for 4 hours.
Well, so my concern is that, you know, in the rural area that we're in, a transport is a 4-hour turnaround time. By the time you get back and clean up the unit and everything's ready to go, you're talking about 3.5, 4 hours of turnaround time. So 2 calls, that's 8 hours that they're burned through the night. And if you get both crews that are doing that, they're going to be tired.
Yeah, their average turnaround time is right around 2 hours. So if they get 4 calls, that's an 8-hour day.
Yeah, and you know, concern for their health, concern for their driving abilities on the road, concern for patient care.
Decision making.
Yep.
It's, you know, and then at the paramedic level, if they get a P1 call, then they've got to really concentrate on what they're doing, because they don't have 2 like we did in San Antonio. They got 1, and it's going to be tough. I really, really, really want y'all to watch. Nothing bad about the crews.
Yep.
They want the money, I understand that, but it's going to wear them down.
And it's something that we have regularly communicated to the crews, that in addition to our observations, they need to observe each other. And we encourage them to step up and come forward and be like, hey, this person's slacking, or, you know, they're not picking up their weight like they normally would. They know to bring that to our attention.
If you have to replace a crew, what's the turnaround time to get a crew back down here?
30 minutes.
Even with I know that Bear County is just killing y'all with all the demands that you got.
Because we have the inter-facility transfer market, I always have staff members that are not dedicated to 911, so I have no contractual obligations. I'll pull those people off the trucks in San Antonio and pull them down here.
Okay.
Period. And I do that for all our areas. I completely agree with and understand your concern. Trust me, Patrick, and it's a concern of myself and Jason. We don't want to put anybody at risk, the crews or the public. Part of the issue that brought this up was a change of staffing when there was a little bit of which way are we going? So some people were going like, I want to leave, I don't want to stay. And then as people left, I'll be honest with you, I didn't start hiring for here because I honestly thought we were leaving in November. So as we fluctuated that and started hiring up for the Bear, we went to the crews and said, hey, look, we're short. We can find more people. How do you want to do this? They asked, if you will, if we can do this. And they said, we'll try it.
And
we told them, if at any time you want this to change, all you got to do is tell me, and we'll staff up to eliminate the 72-hour shifts.
It was not meant to be a permanent solution.
No.
It was meant to be, let's try it out for a couple of months, and we'll reevaluate it. We'll sit the crews down and talk to them. We'll meet Allegiance Management, myself, we'll look at the whole picture, look at their staffing in other areas, and say, okay, now can we go back to a 4896? It was not meant to stay 72-hour shifts indefinitely.
No.
It was supposed to be a 3-month fix. Let's get through the first couple months. They'll get their feet under in Bear County. By that time, they should have plenty of staff. We can reevaluate. And then if we feel and the crews want the need to go back to a 4896, then that's a conversation, and then we turn around and ask Allegiance to open some positions or bring in people from other areas. So, and Allegiance is a big company statewide. They frequently bring in people from Corpus or Dallas or West Texas to pick up shifts all the time. So it is something that we continually reassess.
What's the contract say?
Doesn't say anything about shift hours. It just
No.
says 24-hour coverage
Okay.
for 2 ambulances.
And what's industry practice generally accepted?
For an agency about our call volume, it's 48-hour 96.
So this is a stopgap measure because of Allegiance having a heavier need to stand up the stuff in Bear County. Now it's affecting our end of it, and in addition to this uncertainty that was thrown in.
So it was a double-edged sword, and it kind of benefited both of us, to be completely honest. It helped alleviate some of their staffing issues with onboarding Bear County, and we were undecided. Are we doing our thing? Are we not doing our thing? Month to month. So this was a temporary solution.
When are we going to get back to normal?
Probably, my goal is to be back, hopefully, end of this month, first week of March.
First week of March?
Yeah,
So
February, whatever.
our next meeting, this should all be resolved.
Oh yeah, that's my goal.
I'm not trying to get in guys' pockets or anything. I have the exact same concern.
No,
Even 48. If that's an industry practice, that's for me. I'm thinking, okay.
Yeah, and that's a fairly new. I mean, that's within the last 3 or 4 years that they decided that 48.
it goes a lot off of service area and call volume.
Yeah.
For an agency with our call volume, 48 is not unreasonable. San Antonio Fire cannot do 48s. There's no way.
We had 48. We were working the 4872 for an extended period of time, and it was working fine, and there was no issues. You guys gotta watch this. You gotta watch this close right now.
Oh,
We did
we do.
have
Yeah.
an ass close on this one because
we did have some staffing issues in addition to Allegiance was trying to fulfill more
we
shifts.
didn't have staffing issues.
Allegiance
They had staffing.
They had staffing.
Be very
Yeah.
clear about that.
Well,
But it was something that was originally, when we all talked and met about it, it was supposed to be up for reevaluation at the end of February, beginning of March, to say, is this something that needs to continue, or is it something that we can go back to 4896?
Yeah, and they're 40-hour employees, so they're making overtime after 40 hours.
Sure, yeah.
So I understand.
Yeah, man,
You're making a lot of money. I understand that, but I've driven home, running off the road, and wondered how I got home many a time after I got off shift.
Right.
Yeah.
So
I'm there. Do we have,
trust me.
On that end, do we have, well, at least we can't. Do we have, in that case, do we have the ability to keep somebody or let somebody rack out for a little bit before they go home?
Yes. Allegiance has a policy on it.
yes.
4-hour downtime.
If you're on a truck and you call me and tell me I cannot get up and go again, I'm wore out. I'm not going to let you get on that truck. I'm not going to ask you to get
Well,
on that
I'm
truck.
saying after a long day, it's like
Yeah.
I was just saying, he comes home
Right.
after a long day and you wake up and you're like, I've been there. Wake up and like, my God, how did I get here?
Yeah, yeah.
Holy smokes.
No, we don't want that either.
Yes.
Burning the candle at both ends on these guys is not a way to go for longevity.
Yeah.
So please fix it,
We will.
and please.
We'll reevaluate at the end of this month.
You said 72, 72?
yeah, they're 4-day.
Okay.
All right, are you done? I have a report to give to you.
Okay. As soon as they're...
Yeah. Any
I
other?
don't know how y'all do it, honest to God. I don't.
It's 3 days, 3 days.
Huh?
It's 3 days on, 3 days off.
Oh, I thought y'all were doing 4-4. No? 3-3?
3-3.
3.
Okay, still? Okay. You told me that, and it didn't register for some reason. I'm thinking, because I did 24/72, so I was just thinking the whole.
Some of the crews are still on 48. Some of the EMTs are on a 48. Pick up an extra shift if one's available.
Oh, gotcha.
I also have some trucks that are just 12-hour trucks because of call volume.
Right.
And I don't let those trucks pass that. At max, they'll go 14, but that's it. But again, when, and comparatively, when you look at the industry, you can be in an area where one call a day is like, oh my God, we got a call, thank the Lord, actually get to go to work. And then you have some stations where within 24 hours, they may make 20 calls, and they're never back at the station. And those guys, at that point, you can't function after 24 hours at a station like that. So every one of our stations, even in the Bear, if you will, we look at the call volume and we'll adjust our truck hours according to that volume. So that's why we have some trucks that are at 12, some trucks that are at 24s, and then some are at 48. And the station that gets about one call a day, I told them I could be there 5 days a week. I don't care. Yeah. Yeah. So we watch it closely, sir, to answer your question, and we do want to rectify that anyway. So.
And any other questions for Pat before I get my report?
No, I don't.
You sure? Thank you very much.
Thank you,
Appreciate
sir.
you guys. Thank you.
So I have some things to present to the board. One of the things is in the safety conference, we need to be more specific in our agenda. We cannot just put fire chief's report, EMS chief's report. That is not sufficient. We have to put what is on that report. It can be generic, it can be broad. So I'm asking the board if there are specifics that you would like me to present every month. We need to identify those. So for this month, I have very simple, very basic, because it's the first time, just station facility issues, personnel or contractors, and then apparatuses. And those are my categories. And I have some things to address you on.
I would like to see QA/QI.
Okay.
Without their information, just, I mean, if there's problems.
Redacted.
And you can email that. Of course, obviously, if you email that to us, it's public record and the public can get a hold of that. But just, I mean, that's your job. You promised us a quality service and you were going to be on it, and I want to make sure that that's what you're seeing in the field.
Sure.
I would like to see us call, like per call, cardiac arrest, things that we've done. If we have saves, those need to be public. We need to brag on that kind of thing. If fire is with us and fire got there first and they, help with a save or whatever, we're going to brag about both agencies. But those are the kinds of things, just kind of a breakdown of MDAs, how many MDAs we made, did we have to fly people, just so that the community can see that these are the things that we're doing out there. Because just calling and saying, yeah, we had 214 runs, as the public, they just sit here and go, oh, we had 214 runs.
Right. And so those are some of the things that I can build out into a standing report that I can work with Pat on to collect that data. Any other specifics that you would like to see outlined in the monthly report?
So one of the ones to do that is, in my mind, is if there's anything outside of the contractual requirements.
Okay.
If it's an outlier on times or whatever the service, and then a full rundown, here's what went on. And so you're going to have to get down into the weeds on it and see. And you can with Pat, figure this out. Reconcile it with county records, reconcile it with their records, make sure that they all jive. And that's going to be something you're going to handle during the month.
Sure.
But anything that's outside of those requirements,
Sure.
we need it right there. Identify it right away. Because, like Pat said, we need to crow about the great stuff, but then we need to keep the public here. Obviously, we keep it in public, but we want to have great kudos for the team for doing a good job. But we also need to take in the misses.
Sure.
And come back and figure out how to make the repairs in that.
And I think he's figured out a way with dispatch on how to track mutual aid runs in our district, both in Devine and Natalia.
So, that leads me into the reconciliation part. I got Pat's report yesterday, which new system, so it's going to take us a few months to learn. I did not get to reconcile call for call like I normally do. So the last couple of months I've been able to come up here and present to you and say we had 15, 20 mutual aids into our district. I didn't get the chance to do that this month. They had a new system, I got the report, and I didn't get to reconcile call for call. I do have a report from the sheriff's office, from dispatch, of how many total calls, and it's pretty close to what Pat's report.
When do you usually get that report from Pat?
So this month, yesterday was late.
Normally.
But it's usually end of the month, so we've been
Okay,
doing.
got it. So you would be looking at January's calls
Yes.
at this meeting?
Yes.
Got it. Thank you.
That was kind of our expectation over the last couple of months, unless we want something.
Because that gives you enough time to do the work on it.
Yeah, because that's one of the reasons why our meeting is on the date that it is. So it gives me a week or so usually to reconcile those calls. But our call volume from the sheriff's office is pretty close to what Pat is presenting. Like I said, I just didn't get to reconcile for mutual aids this month. It is something I can present next month. Some of the station issues we'll talk about when we get to quotes and what those are in regards to. One of the other things I would like to ask the board is officially, there's been a lot of hearsay since I've started last May, and I would like to get the board's actual direction, what your expectation is for the time frame that our crews should be posting in Natalia until we decide to either build a station or whatever it is that we decide to do. What is that time frame? Right now, shift change is 8 a.m. So I tell them by 9 o'clock, that gives them time to check their truck, wash their truck, stock their truck, eat breakfast, do whatever they need to do, and get to Natalia. They're supposed to be in Natalia at 9 o'clock. And then they can come back here. I said 5 usually because it's starting to get dark around that time. They can eat.
While you're talking about that, what do they have access to facilities in Natalia? Or are they
Yes.
sleeping in the ambulance or hanging
No.
out in the unit all day?
So they do have access. They stay at the Natalia Fire Station, ESD5. I've requested from ESD5, unless Christy can provide it. ESD5 claims that they have an MOU with our board previously. I'm still waiting to receive that copy from them. But they agreed when I went and asked their board if we could put in the shoreline to plug the ambulance in. They said yes, in our mutual agreement it is, we'll provide whatever it is your crews need.
And do they have a comfortable place to hang out there?
They do in the day room. They have a sofa and some recliners that Allegiance purchased. We did find out from Allegiance, some of the crews have said that their recliner is broken. I said, I'm not going to ask this board to pay for furniture to go into somebody else's station. But Allegiance said that they provided that and it should be under warranty, so it is something that we're working with Allegiance on replacing. My question to the board is time frame. Is 8 hours a day posting okay? Do you want to make it 12 hours? I know the end goal is to make it a 24-hour post. But until we talk about facilities and what the board wants to do with that, I need some guidance to be able to hold them to. And
Is it working out now?
Yes, there have been some crews that have been a little bit lazy about getting over there, but I feel like we've addressed that.
But it's working out now.
It is working.
So my concern was the last meeting. I've been kicking this idea around. The last meeting we were like, well, it's only 6 minutes away. Well, honest to God, 4 to 6 minutes, if you're in cardiac arrest, your brain's dying.
It matters.
So 6 minutes sounds like a minuscule time in time to drive, but 6 minutes is life and death.
It matters.
People. So to me, if we can get them to post over there, I know that they have training nights and meeting nights at the station. I understand them needing to leave. I understand that it's not very comfortable over there, and there's 2 guys that's not getting socialized with the other 2 people that are here, and that's part of stress relief. So I understand that, but to me, if we can keep them over longer until we figure out a way to solve this issue. Natalia's presented us with a great idea. We've just got to come up with the funding for it. Mm-hmm. And I agree. The citizens of Natalia, they're just like us, and us in the rural area, they deserve to have an ambulance over there. They're paying taxes just like we are. So I agree to move forward with that idea. It's just the funding issue. But I don't. 9 to 5, that's an 8-hour day.
Granted, they're not on calls.
Right. To me, I don't know. Because it gets uncomfortable over there. I mean, I don't know what's over there for them to do.
And case in point, the crew their last shift, I'm going to point to him, I'm calling him out. Their AC is set at 75, it's locked, it's controlled, it's something we don't have access to. Right? It's something minute, right? But at the same time, it's not our station. I can't tell them, go in there and change it.
Right.
So, and there is nothing in our contract that says anything about them having to post in Natalia. So I can't go back to that and say, well, you're supposed to be there from this time to this time. That's why I'm coming to the board and saying, what is your expectation? I feel like 8 hours is fair. I know that the reality is we want 24, but we're not there yet.
Are we at risk of, with the 8-hour piece, is that adequate to meet the call volume that's there, being that faster response? Or is it, we have there's going to be a general time, a block of time where we see more calls. So is that during that 8-hour period?
It's inconsistent.
It is inconsistent, okay.
Because it could be nothing all day.
I completely understand that, but
Yeah.
there are other times where people aren't calling for a flu call at 2 in the morning.
Oh, you'd be surprised.
Yeah.
I say that, right?
Yeah. It's inconsistent. And there are days that Devine never turns a wheel and Natalia never stops. And vice versa, right? And again, if Devine is out, the Natalia truck is coming over here. If the Devine truck is here and Natalia is out, well, now Devine has to go to Natalia to back them up, right? So either way, you have a delay until we can get another truck.
I'm agnostic right now. I don't have enough information, so I'll you guys have more understanding on this one.
Well, if I may, when you look at those numbers that we're talking about, the city of Natalia itself had 25 calls. But if you look at the county calls, a lot of those calls are in that Natalia area outside of the city limits. Now, just FYI, I only bring this up because historically, we told the board in the past, we'll do whatever you want us to do. You want us over there 12 hours? We'll stay over there 12 hours. It's not that big a deal. The only thing, and I had a conversation with Jason on this today. I said, the only problem with the Natalia station, if you want to call it a problem, is we can't do it 24 because there's no bathing facilities. There's limited on kitchen and things like that. So we'd have to try to find some way to make that happen. But I just want you to know from our perspective, in the past, the board asked for 12 hours, and that's what we were doing. That kind of faded away over time. But we've always been there at least 8 hours. But I think we don't mind doing whatever. We can shift it to a peak hour time if we want to track the peak hours. But again, they are citizens. We are responsible to cover their area. And from our perspective, we'll do whatever you ask us to do. That's not a big issue with us.
I can't speak to the volume trends. The majority of the calls in the Devine area come from the Devine city limits. Majority of the calls in the Natalia area do not come from the city limits. But if you look at call volume, Devine and Natalia, they're pretty one for one.
The numbers at the end of the report, I believe that the Devine unit had 109 out of that 214, and then the Natalia unit had 105. That's how tight they are. And those numbers they're helping each other as well. So it's just kind of a mixture.
What do you think about 10-14 shift? 10 hours there, 14 here?
I think that would work.
Just start off with to see how that pans out.
And then we can monitor the call volume and see if we need to change it or either direction.
The original when Allegiance came was 16-hour shifts. I think we went to 12 right when you came off.
I'm sorry?
Right?
She said the initial agreement was Allegiance was 16 hours out of
I
the
tried to
day.
go through the minutes to find out.
In
what
Natalia?
was minutes, yeah.
No, I think it was 12. My memory. I don't think it was ever 16.
Yeah, so 12, if you look at going over there at 9 o'clock, that puts them 9 o'clock at night coming back over here. 10 hours puts them at 7 p.m. What do y'all think back there?
Yes.
Build.
I'm with you.
Honestly, 100% with you on that. It's money. Hey, you got it.
Well, I think that the fair thing would be, to me is it would be a 24 hours, you split 12 over here, 12 over here. You know, initially, when we started this ESD business, you know, people came to me. I was mayor back then, and you know, everybody, you know, promised me the moon, and we took off and we went door to door, knocking on doors, making sure that everybody voted for this thing. But it was always with the premise that we were going to have somebody permanent within our community to be able to, you know, to do what needed to be done. So I know that I have gotten lots of phone calls. I'm not going to say lots, but I have gotten phone calls. I can't go anywhere without somebody asking me something. But, you know, wanting to know why the ambulances aren't there anymore like they used to be. And I can't tell them because I don't come to the meetings, okay? I mean, and this is my first one, so I'm kind of observing how y'all are doing things here. But I think that, I know that when I have needed the ambulance for myself, or my family, you know, there has been no issues in getting them there immediately, especially this young man right over here. Kudos to him and that young lady that just took off to go upstairs. I mean, very, very customer oriented, you know, especially I have an elderly aunt that's 98 years old. They treated her like, you know, with gloves. So
it is something that we recognize, and we are trying to enforce more often.
That I do, and I think that maybe if we were to know, I'm not saying it's going to happen, but it's something we surely can talk about between the ESD and the city. If it's a matter of something else that they might need in that facility right now, that we could possibly help with.
Sure.
Okay, but you can't do something about something that you don't know about.
Agreed. Which brings me to another speaking moment, speaking item. I got a lot.
I'm like Ruby, I like the 12. Seems more natural than 7.5, 13.5, or whatever.
You say 12.
Yeah. 12. Okay.
So we have 10 and 12.
I'm good for 12. You good for 12, Derek? Tony?
12.
Okay.
That was the original agreement. She commented in the minutes, 12 hours.
12 hours a day.
Just like you said, you wouldn't bang on doors, or, you know, you wanted that support from the community where you could repay that.
Absolutely.
Well, it's not just to repay it, it's just
No.
I think
We do. We always do that.
it's necessary that you know, that for folks to understand that whatever, how much money that they're paying in taxes, that maybe they're not going to get it initially, but it's for the community.
If the expectation is there, we need to uphold it.
Oh, again, we help push us like help get it started.
Absolutely.
Again, door to door, not all of our you know, council did door to door. That's not all right.
I was there with you. We know. And it's been since 2007 when the ESDs were created. So, you know, we do need to do something.
So don't leave. There's more to talk about on this very matter on the agenda.
Okay. But I got a little girl I got to go pick up from a track meet, so
I get
can
it.
we move it up?
So,
9 to 9.
9 to 9.
9 to 9.
We'll do 9 to 9, yeah.
And then we're going to need to walk the dog and figure out this MOU stuff.
Yes, I'm on it.
Whatever we got to do. We got to go kiss babies over there.
I got it. I'm taking him with me.
And, you know, honestly, Jason, I personally, not speaking for the board, if we've got to fix something over there, if we need to buy furniture, we can move that out when we make a building.
Sure.
So, you know, I mean, obviously we can't spend crazy money, but I mean, if there's something that we can make it better for them, you know, maybe they need a refrigerator over there.
Sure.
That's in our name, that they can put stuff in the refrigerator so they can have food over there. I don't know if they can cook, you know, because it gets expensive going out 3 times a day to eat. I understand that, especially nowadays when things cost. So,
Well, I'm gonna, now that we have a designated thing, I have something to take back and do an evaluation. So that next month I can give you more information.
okay.
Some of the other things under personnel and contractors, we attended safety conference last week. access to the filing cabinets, I'd like to be able to move those filing cabinets into our supply room or my office to get them out of here, if possible.
Is there a reason they're not?
It's got old documents. Some of it can be thrown away.
Is there a reason that they're even out here? Is there?
I don't have access to anything in them. So if you come up here and say, "Can I see this?" I can't give it to you.
I'm the one that has a TV and I have to make a copy. The thing that's in there is all the previous, now new electronics, so nothing will go in there. It's y'all's personal files that are in there, because we have to keep files on all the classes that you take, all the information that we give you. That is in there. But we only have to keep it for 5 years, so some of that stuff can come out.
Fine, but is there any reason why it's out here and not in the office?
Originally, this was back when...
It was the crew quarters down here.
It was cruise port. No, yes. So when the... Yes.
It was their bunk rooms because there was no upstairs.
So when we built upstairs, it was said in the meeting that the only people allowed in this building, or in this portion of it, was ESD.
Oh, because they've got complete living quarters up there now.
That's correct.
Okay.
So I guess one of the agenda items, what you're getting to, is if you're going to allow Devine to come in here and use it, he just wants to put it where it's more safe. That's what he's messing with it.
I don't need the board's approval to move it. It's just if you come in and ask me to produce a document that I don't have, we need to be able to have access to it or put it
The
electronic.
contracts and everything about the ESD are in those cabinets?
The original files that Holly started is the only one that I have not gotten rid of, but we only have to keep documents for 5 years. So as we go, we toss, but now everything's electronic. Because now I have to share it with the auditor.
So we have to keep certain documents, actually they changed that to 7 years, and they suggested that all minutes of meetings and all meeting agenda items are saved forever and ever, amen.
Yes.
Okay, so we as a board should be able to come down here anytime and say, hey, we need to look in this cabinet and look at February of 2019, what was said, because a citizen asked me, hey, I thought y'all did that. We need to be able to have access to that so that we can do that, and so does he.
The alternative would be we do an electronic drive that everybody has access to.
Well, and this system I don't think it's friendly to that. Google, Gmail was 100% friendly to that. But there's web providers, Clint had given me a web provider that can make us...
You can do secured global drives.
Yes.
That any one of you could access remotely that only you would be able to access.
Right.
It wouldn't be available to anybody else. So that can be another agenda discussion later on.
And if he's going to move this into his office or into that
Supply room.
you just put a lock on that and give him a lock.
And I ordered the locks for those 2 doors anyway. So
I mean, it doesn't necessarily have to be locked. It's locked out.
Right. It just needs to be accessible to us.
Yes.
Yes.
I would like to request the board.
So as long as we got to keep the room, that's all.
Yes.
Lock it up.
Yep. I would like to request the board to appoint a subcommittee between yourselves for future discussions in regards to the Natalia station to bring back to the board.
And that is so that,
Committee out of 5.
so that we can speak outside of it and have a discussion, bring back the board outside.
So 2 board members is what you have to have.
Yeah.
Yeah, a subcommittee is just any 2 members.
That just allows us to have candid discussions and then bring back whatever recommendation comes out of it to the board.
Okay. And I would like to see maybe a council member or 2 from Natalia on it as well.
I think
So that's my next talking point is
Well, I'm just trying to speed it up.
I'd like to ask, in addition to that, the subcommittee of your board in discussing the future growth and business plan of our EMS, whether it's privatized or owned by us, doesn't really matter, but we have no 5-year plan. We have no 10-year plan. We have no 100-year plan for what does the community expect of us as a governing entity. So I would like to ask 2 members to appoint a subcommittee to include and be able to host those discussions to include the public. It's not uncommon. It's done in a lot of other agencies and districts. Doesn't have to be decided right now, but a talking point. I do have a QA report that we had one incident, not really an incident, more of a concern on January 27th with a crew that I responded to. There were some initial concerns in regards to the patient care, being on scene, and being delivered in a timely manner. I was able to talk with the crew. I counseled them once they returned. We talked about the concerns, and we have implemented actions to resolving those.
What's your action on this?
It's the one we talked about earlier this afternoon. So,
what's the actions on that from personnel side?
I'm sorry?
What's your actions on that for the issue, the corrective action, or whatever needs to happen, training, whatever,
Review of process.
Okay.
There was our policy is that when you go into a call, right, you go into a home, you take the stretcher with you. You take all the equipment that's on that stretcher with you, because everything you need is in those cases. In this particular call, because of the restriction of a stairwell and getting access into the home, the crew hesitated, causing that delay. Because Jason and another person were on scene as well, people start moving quickly, and it's, where's this? And well, it's right there, but right there's not in the room, right there's outside. So that was, I get it, stairwell, object in the way, but we have to address that and say we find a way. There's ways around that, and those are being addressed. One of our solutions is to, in this particular case, an oxygen tank is attached to the stretcher. And so you have, when you go in the house, it's there. You just you can hook everything up to it. But if it's not in the house, obviously you got to go hunt it down. Our solution to that is just get a bag, carry it in with you, and don't worry about the stretcher. But take your bags in with you, because your bags have all your equipment.
And
has that been implemented?
yes, it has.
No, that's our policy.
It is our policy. A memo went out Allegiance-wide the day after to all of Allegiance statewide, saying, "Hey, this is our policy. It's expectation."
What was the impact of care?
Just a delay.
Things turned out well after.
Outcome was fine.
It was just the issue that, as anything, not every call is going to be the same.
Mm-hmm.
You can plan all you want, and we do plan all we can. But when you have obstacles in place and create a change of environment, you just have to convince people that you have to think outside the box. Right? Okay, you can't get your stretcher in there, but just take all your stuff with you.
Yeah,
right?
The outcome was still
I
positive.
get it. I've been to houses where the stretcher doesn't go in, won't even fit. You can't even get a backboard in there, much less a stretcher. But you can get your O2 bottle and your jump kits. So they just didn't think out of the box. They hesitated because of the obstruction, and that should have happened.
So it just sounds like a training issue.
Yes.
Okay.
And it's been addressed.
Absolutely.
In our subcommittee review that we had with budget, Commissioner Smith recommended that I attend a certified contract manager's course in Austin. The cost is $435, and it would require one night hotel stay.
Is there another one down in
That one's already passed. I have the dates over there. So it's $435, but it's a certified contract manager. I need approval from you guys to do that.
So this was part of the discussion about refocusing all of Jason's efforts into contract management as opposed to personnel management. Shouldn't be handling personnel, shouldn't be liability involved there for us from the ESD, that this is a contractual responsibility, and it's the personnel stuff needs to be handled by Pat as opposed to handled by Jason. So it's the refocus, and then we have a certified contract manager handling the day-to-day contract management operations and the understanding thereof.
That's under the $500 limit. and it's not on the agenda, I'm good for saying, yes, you can go.
Okay.
Are you all good with that?
So we're talking $435 plus
One night.
per diem.
Well, one hotel stay, yeah. One night hotel stay.
Yeah, but you have food too. So we're probably looking at more like
$600.
600. Yeah, about
Something like that. Where's it at in Austin?
Austin.
$750.
That's not true. We can get the government rate. We can get the GSA rate. 8140. One of our ambulances actually out of service. It's at sit-ins getting work.
It's still there?
Yes. I got an update today.
I told you that was going to be 2 months at least.
Well, so the funny thing is our president has this whole trade war going on, and the part is actually stuck at customs. So once it clears customs, then it will be shipped to sit-ins, and they can do the work.
Does that have a 10-speed transmission in it?
Yes, sir, it does. Both of them.
I have 2 buddies that just replaced their 10-speed transmissions in their truck. One had 14,000 miles, the other had 34,000 miles.
Good thing is they're still under warranty. So it is, and the services, the maintenance or repairs are covered under the warranty. That's why it's at sit-ins.
Right.
But it's fine. But they don't provide a replacement.
Nope, but Allegiance does because it's their contract obligation. So
Understand.
that's why one of the trucks says Allegiance. Pat sent me his prettiest one. So that's all.
Like a super racer.
That's all I have for the.
No problem with service.
No.
Service, so we're okay.
Not as of right now.
And when do we anticipate that back?
As soon as part clears customs, sir. So when the federal government decides to relinquish our parts, they are Canadian trucks. The chassis came from Kansas. The trucks are from Canada.
No wonder.
Saskatchewan, to be specific.
Socialist truck.
Okay, so you got that. You're good to go. When is that class?
So there are several.
Okay. All right, we're good then.
Okay.
Okay, so item number 6, nomination of officers, president, vice president, secretary, treasurer, and assistant treasurer.
Only 18 to go.
Yeah, we can crank through these ones. So I just wrote these up as for discussion items for us as far as duties and responsibilities for each of the positions. This is not by any means set in stone. I look to others for more insight if there's changes, anything else. But I think it's important that we get this stuff nailed down. That okay, I know what my lane is, and I can make sure I can stay in it, and I can handle it and make sure my lane is taken care of. All that said, we do need to hash out who's going to do what, and I think it's right now we've got you and Juan that have been here and have the solid understanding. I think that the 3 of us should take on the primary roles and then have you guys serve as the secondary advisor, going like, no, that's stupid, don't do that. No, that's stupid, don't do that. In there, and as such, that we have president, vice president, secretary, treasurer, and an assistant treasurer. Those 5 positions. You already talked to Juan about.
He wants to step down from treasurer.
And so, Jerry, you don't want to be a secretary anymore, do you?
Well,
He wants to be secretary because we have a secretary.
Oh, but she's not a secretary.
Well, she's taking all the minutes. He doesn't have to take any
Let the man
minutes.
speak, for God's sakes.
thank you. I'm kind of contrary to your suggestion. I think Tony has been here the longest,
Yeah.
and I think he's in a position to where maybe he ought to see this thing to fruition as a president.
Okay.
And I don't have a problem with him staying on as president. I don't want it. Secretary sounds good to me because I don't want any of the other roles. And in fact, when my tenure's up, I'm gone. So I'm just here for,
Who's your replacement?
I don't know.
Well, you got to find your replacement before you can go.
Well, you want to bet? Peggy Howard. But as far as the officers goes, I don't care who's president. I don't care who's vice president. As long as stuff gets done. And if we need to nominate people, go for it. I'm content where I am.
Okay.
Well, I'm in agreement with Steve. I think that I'm ready for the change. And I would like Steve as the president, me as the treasurer, Tony as the vice president, and Juan as the assistant treasurer. That's my thought.
Yeah, Tony, what do you think?
I don't care. You know, I'll stay president, that's fine. Yeah, I probably won't be back after December, so.
Yeah.
You don't think so?
You're gonna double your pay, right?
What's that?
You're gonna double his pay.
Yeah. All right. And are you done in December? No, because you're on a.
It's Juan and I.
Just.
Juan and I.
Okay.
December.
Well, I'm willing to serve wherever we need. The role when I laid this stuff out, it's really the president's the external, the vice president's the internal functions. Secretary is, the records and the communication piece. The treasurer is the financial end of it, but then the assistant treasurer is really going to be focused on contract.
And I'm going to rely on Juan's understanding of government finances and deadlines and all that stuff, especially since that's his life as a CFO for a school district.
Yeah.
So my nomination is you for president, vice president, treasurer, Juan as assistant treasurer, and Jerry as the secretary.
Good. I'm good with that. You guys good with that?
Matter to me.
All right, I'll make a motion that we do those office positions as mentioned.
I second.
Have a motion and a second. All in favor, say aye.
Aye.
Opposed, same sign. Passes
When
unanimously.
is that
Back just
effective?
for a minute, repeat what you just said.
So, Tony,
President,
Okay?
vice president,
Okay.
treasurer, Juan is the assistant treasurer, Jerry is the secretary.
Thank you.
See you later.
I don't think so, Tim.
And who seconded, Stephen?
I did.
Steve.
Yeah. Actually, I'm going to get a cup of coffee.
Yeah, I want a liquid refreshment, that's not it. Are you making coffee?
I'm making coffee.
Darn it!
Well, I'll make you one, okay?
Okay,
That's what I'm here for. Black and bitter?
I'm ready to move on.
Okay, review, discuss, and approve the minutes. Has anybody had a chance to look at those?
Yes, sir.
You have any suggestions?
I make a motion to accept the minutes
Second.
posted.
Have a motion and a second. All in favor, say aye.
Aye.
Opposed, same sign. Unanimous. Review, discuss the approval of the financial report.
Sorry, I've got to dig into this a little bit.
Okay.
So, Christie, I have a couple of questions. We've approved some of this, but I'm digging through all this stuff, trying to get a grasp on what's going on. We have spent with Amazon about $3,400 since October. What are we buying from Amazon?
So our water was coming, our paper, our ink cartridges. Then at the end of the month, or at the end of December, I have to, or at the end of the fiscal year, I have to purchase folders because we had folders here. Labels, I have to purchase the 1099s, the 1096s for the taxes. The biggest expense is the printer cartridges for his printer and the printer that I have.
Okay, so when I'm looking through this P&L, the detailed P&L that you gave me, I'm looking at the memo section for all of those purchases. A few of them have items in there. Most of them don't have any explanation as to what you're buying. And I really want you to fix that.
Okay.
The other one is, we're paying DirecTV. I thought you said we got rid of that.
We only paid last month, but it was canceled last month.
No, we paid it again this month on January.
You're looking at January's. So January was our last payment.
On January's P&L, because we paid $223.45 to DirecTV since October.
Is that the catching up from the last month when we canceled it? What day
We canceled it in January. So we had one for January and that was it. And now we're not going to get charged. We don't have any charges for February because it comes out.
Okay.
We canceled it in
In January, there was a $24 Netflix fee in there too.
Yes, we don't know who the Netflix belongs to.
Okay.
So it has to be one of the tablets.
You protested that, and did we get our money back on that?
No.
All right.
Oh, I protested it, but we did not get the money back. I called them and said, nobody has access. So when we got the tablets to download, you had to put a credit card into the tablets. So the originals. So like yours, you won't be able to get anything off the App Store because you don't have a credit card on file.
I don't even open it up, but okay.
I know, but I'm just,
Where are you at, Patrick?
I'm explaining. So when we got,
We're on financials.
I understand that, but I mean, I'm trying to find what you're talking about here.
I'm looking at the P&L detailed.
P&L, I don't see P&L on here.
So if you look at, I did a Jerry and I printed it out, sir.
Well, that's what
I'm like you, I can't look through a computer and do it.
that's what I'm gonna suggest from now on.
Yeah.
You can take this,
so when we originally bought the tablets, we had to put credit cards in. So the credit card that was on there was on file. I brought this up last month when we met and said, hey, there's a charge of 24. I called them and told them they did not have access to use that card. They could not tell me who the account holder was because it's not mine. They
Okay.
could not tell me who it was, and I explained to them that they do not have authorization to use this credit card at all.
Did you cancel the card?
Yes.
Okay.
So I don't know who, because you guys just got the tablets. Tony has his tablet.
One's missing.
Juan's is missing, and Jerry just got a tablet. So I don't know whose tablet it is actually on at this time, but the card has been canceled.
So there was also in November, there was a bill from Costco for $130.
That is the annual fee. Remember, when we met, I told you that was the annual fee for the Costco?
I thought we
We're not renewing it.
Okay, so I, for some reason, was under the understanding that we didn't have Costco account. Okay,
So that will not be renewing. So we have it for one more year and that's it.
that's all the questions that oh no, I have one more question. There is a breakdown in here, I'm sorry, what is G1 Air?
The air conditioner. It used to be Zensmeyer. It used to be Zensmeyer air conditioner out of Castroville. It's now called G1.
So are they doing like a monthly thing? Because I see them repeatedly in here.
We had a lot of issues.
We had a lot of issues with the upstairs air conditioners. There was, at one time, the gentleman came, because upstairs AC was not working. And the crews were miserable. I went up there one day, it was like 85 degrees. It was unbearable.
And if y'all have a problem like that, call somebody or call him, please. I don't want y'all living in that kind of stuff. Anyway, go ahead.
So we've resolved that. It costs, I think that last time they fixed it was like $1,000. It was like 900.
Yes, because we had to change something that was upstairs. I guess there was one that was not a draining pot thing.
It wasn't draining properly. The condensation was backing up, blocking the flow. It was the thing. Then it quit again. The air conditioner guy came and he was like, no, this is what you need to do. This is how you need to blow out all the drains. There's a way you need to do it. I said, okay, no big deal. Show us so we don't have to call you every single time this happens. We happened again. We took our little air compressor upstairs. We blew it all out. The AC still wasn't cooling. 2 hours later, when the AC guy shows up, guess what? The AC started cooling. It kicked on and started cooling.
No.
Like going to a mechanic.
Yeah, they still charged us a call-out fee, I'm sure. But he looked right at me and he said, y'all have already fixed it. Just
Okay.
give it some time.
So it just took a little time for it to start cooling.
Okay, so I have one other question to clarify. Under Jason's account, you have 3 different bills that we're paying. $3,800, $238, and $55. What is that? All it does is say Jason. I don't know what it's for.
That's a question I don't know because it's direct deposit.
Okay, so on all of these things, please add memos so that we can see, so that if I ask you questions, like, oh, that's for so-and-so.
So with it being the 238 for 47 each time, I believe that's his, something to do with his taxes. Because it's the
Probably
same.
payroll taxes.
Yeah, because it's the same, so it's probably payroll taxes.
So like state and federal taxes, Social Security and federal taxes, okay.
And that will change because he's changed his W-4, so next month it didn't go into effect this paycheck, but next paycheck it should change it because he's changed his exemptions.
I don't know. Again, I've got,
My CPA that does my taxes says you need to change your W-4, and I said, great. So I updated it and sent it to Christy and said, please do this.
So you should, so if the way you should see another line item of the additional amount that he's taken out. But with it being the same, I'm going to assume that it's his taxes because his check doesn't change.
okay, so I don't have any further questions on that. Do you need, are we going to go with the other two items, or are we going to make a motion to pass the finance report?
Well, I've got a financial question.
Yes, sir.
I think I told you about it last week, but a couple of days before we went to Austin,
Oh, yeah.
I had the bank call me and ask me about somebody's trying to deposit a check in an account that's inactive or something. And the gal told me, I don't know how much I can tell you. So, well, I don't know how much I need to know, but she said, well, it's from Christy. And I said, well, I'll give you her phone number. You can call her and ask her. I said, I don't know what you're talking about. So I assume they called you.
She told him it was a check from you that was being deposited into an account.
In the 0504, and that's all I know. So I gave her the phone number, and I assumed that they contacted you. I don't know.
Did you, the check that I gave you, did you deposit it into Community National Bank? Yes, because it's cleared.
That's probably it.
But it's community. What bank was it?
Community, I think.
Oh.
The local one here.
The local one is Security State.
Yeah, Security Bank, this one here.
Are you sure you went to community?
Well, the one in Lytle, whatever the one's in Lytle.
I don't know.
Okay. You have signature cards for us tonight, right?
Yeah, I was just gonna say.
No, you have to take the minutes over and then go
It's
from
over
there.
there, so once it's done,
Yeah.
No, you take those with the cards.
right.
No, everything's electronic. So what you do is you'll take the minutes over and then they'll send you a paper via email and send it to you.
It's another damn app that I've got to download. Great.
Sorry, I don't make the rules. Nobody's called me
It's
unless it's something that I paid somebody else.
Put it on your iPad.
Wow. Yeah, that's not here. So do you want to continue with those items, or do you want to do the finance report and then go to the other items? Tony?
Let's go ahead and just do that one since it's a line item by itself.
It's past the financial?
Yeah, yeah.
I make a motion that we pass the financial report. From second.
We have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign.
Second by Steve. ESD Budget Committee report. So we started digging into the budget in the committee. I met with Steve and Jason and Christy, and the budget, the prepared budget for this year got compressed. A lot of the line items got compressed, so I am still trying to dig out line items to figure out where they're supposed to go, so we can break it down and actually see where things go. And so basically my report is that I'm digging right now. I think by next month's meeting that I'll be able to present the budget numbers as they were approved in line items so that we know where we're at. It just got really convoluted, and Christy and I are trying to dig those out. Christy?
I'm with what you said.
Okay.
Okay. So we'll have it by
Next month. By next month, I'll have the numbers. The numbers will be presented so that we can actually look at a budget versus actual statement, because she provided it to us, but it's not true with the line items that are there right now. There's no way to really do a good comparison.
Okay. So we'll table that for next month. District coordinator pay.
I don't know what was that about.
I'm guessing you're up on that one.
Once more, I've requested that that be on the agenda because of the misunderstanding between the $25,000 that was originally accepted in September's budget. I paid myself for October and November at the $25,000, and that's when he brought to the board last month saying that that's not.
That was never approved.
That was never approved, and so.
Yeah, the total was like $6,000 or so that I recall. It was 3 payments, October.
It's $7,100. My discussion with Juan was this. You now have signed a contract with the ESD for $11,200 for the year. You have been paid roughly $8,000 with the $950 that you paid last month, last month and this month. So when you get to 11/2, and this is what I explained to him, when you get to 11/2, that's it. We're done for the year. We've met the written agreement that we have between the ESD and with you. And his worry was that you might leave. And I said, well, the smart person that she is, she put a parachute clause in there that if we terminated her, she gets her full payment anyway. So it really doesn't make, it's a catch-22. It don't make a difference. So to me, I say I would like to make it official that what is paid, and when we get to the contractual amount, then we're done for the year.
So then, essentially, then I would say that we paid in advance
Yes.
for a period, and then once it hits, then.
There was a miscommunication with her and with the board, or with Juan, I don't know. I have no idea what happened.
But we didn't have approval. We didn't have board approval for the expenditure.
But here's the catch. She has a justified argument in that the board paid her. One of them was a written check signed by board members. And I don't know who signed it. I don't know how that transpired. But when you sign a check, you can't play stupid afterwards and say we shouldn't have done it.
I'm with you. So, okay.
I say no harm, no foul. Let's just move on. To finish the contract as it's agreed between the board and between Christie.
So you're saying that
11/2 is what the agreement is for the 1 year period.
And then when's that 1 year period up?
September 31st.
So, okay. So I guess that for that, then we would end up not paying anything, putting any expenditures in, say, July or October or August.
Or if you need us to
or prorate
slow that down where you get a payment every month. I don't know how your finances are, but the agreement is that we would pay her 11/2. There's no monthly payment that's agreed to in there. It's just that, and what has happened is they broke that 11/2 into 12-month period, and that's how they came up with the dollar figure.
Oh, well, I think that's the correct way to handle it too, in my mind. We've already got to pay in advance, and now it's
She's prorated.
been prorated essentially in advance, so it's pretty.
So I want to make this official so that this argument is ended. I make a motion that we do the contract as said to the dollar amount, and whenever we get done with the dollar amount, then we're good until the end of the year. Christie, are you good with that? Well, you signed a contract. You have legally signed a contract. You're bound to that contract for a year.
The only thing I ask is if that is the agreement that when it comes time for the budget, that I have a right to come back and ask for additional funds.
Sure. At October 31st, your contract ends.
It can always be amended, and it can always be reviewed again.
Are you saying that at the point where we come back in, you're going to be investing more time? Is that what you mean?
She's going to renegotiate her contract. That's everybody's right. We have the right to say no.
I would wholeheartedly expect it. If you didn't, I would be very disappointed.
Yeah, a good business person is going to renegotiate a contract.
I agree with you. I personally agree with you. I would second that.
Okay, so I have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Review, discuss, and approve workers' comp quote.
So, when we met back last month,
For the budget committee.
For the budget committee, Mr. Dubose asked about workers' comp. At that time, we did not have workers' comp, so he requested that I contact VFIS, because that's who our insurance with,
Correct.
to request a workers' comp only on Jason. So you received it in your, here is a copy if you'd like to review it. Received it.
Jerry?
Yeah.
So I found that one.
Oh, you're getting better.
Yeah.
But from what I'm understanding, this workers' comp also covers if anybody like yourself or anything gets injured on the property as well.
Us?
Yes.
We're considered employees of the district, yes. So where this came from is we're having a discussion, and Jason is our employee. We've hired him. When he's here, he's not covered under healthcare insurance, because if something happens here, they're going to say, did it happen at work? Yes. Okay, we'll deny the claim. He needs to be covered under workers' comp. And so that's where this discussion came from. It's not in the budget, and what I would like to do is approve this, and then I personally like a zero-based budget. That's what I would like to do. And so we'll look at the budget and move, if there's money that we can move from one line item to cover the expense. That's what I would like to do.
This is something we
have to do.
Yes.
So I think it's not.
We're legally liable.
It's not even a question. We'll just figure it out. So we're not going to increase the budget at all.
I make a motion that we approve the amount for workers' comp insurance at $2,925 as provided by Texas Mutual, who is their agent.
And that's annual?
Yes.
Okay. Second.
Have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Unanimous. Review, discuss, and approve plumbing proposals.
Let me grab a copy of that. It was on the printer. I'm sorry.
So,
This was
you were
to,
talking to me, weren't you?
sorry, this was, if you remember a couple months ago, we discussed moving the plumbing for the washer and dryer and eliminating the one water heater and tying it into the existing water heater. I have two quotes. One is from Acosta Plumbing, which is a local guy that came highly recommended. I highly recommend him too because he is significantly cheaper.
What was that AJO?
So, yeah, let me pull it up. It's not done. Sorry. So AJ.
Oh, I was thinking, okay.
Yeah, this was the original quote that we had. It was actually back in October 2024. And then it says in there that the quote would expire after 30 days, 60 days, whatever. So I asked them for an updated quote. This is what their price came out to be, $36.90. The cost of Plumbing's was $15.85 to do the exact same scope of work. So my recommendation would be to go with the Costa Plumbing. He also said he'd have it done in a matter of 2 to 3 hours at most.
So this guy's done work on my rent house and out at our place. He's a great guy. They take care of business. With that said, I make a motion that we go with Costa Plumbing to rework that for $1,585, $1,585.
Is this going to correct the situation?
Yes.
A second.
Okay, I have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign.
Anybody who made the motion? Patrick?
I made the motion.
Patrick.
Jerry second.
Review, discuss, and approve radios reprogramming proposal.
Okay, so this
Hank, I'm gonna come up with this one. I found out that these guys gotta listen to the radio 24 hours while they're trying to sleep at night. There's no tone out, there's nothing that they can hear. They have to listen to that radio while they're trying to sleep. And I can guarantee you, if you're doing that, you're not sleeping, because those radios are horrible. And every time a tone goes out in this county, you think, is that mine or not? When I found that out that they were doing that, I asked Jason to get us quotes to come in and reprogram the radios so that they can go into private call mode. I don't know why it wasn't done in the beginning, but it needs to be done. Same thing with the station radio. That thing blares all night long, so they're listening to either their portables or the station radios all the time. And if for some reason they miss a call, they didn't hear it while they were sleeping to get up for that run, there's nothing that alerts on their radios. So, go ahead, Jason.
So I got 2 quotes. One is from Command and Communications, who came recommended. The problem is they're out of Houston or Spring, Texas, so we'd have to pay them to drive 550 miles, which I highly discourage. The other gentleman is Alamo Public Safety. I've known and worked with this gentleman before. He's actually installed and programmed the radios into all 3 of our vehicles. So he's very well known and recommended in our area, and his quote is like $1,000 cheaper.
So, does he, your concern was he couldn't program the Kenwoods, he fixed that?
Yeah, so I did talk to him, I had a discussion with him when I was obtaining the quote. If he could obtain the Kenwood, it depended on the specific model of that radio. I relayed that to him. He said that if he doesn't have the software, he can either get it from dispatch or one of his other radio buddies locally out of San Antonio. I said, if worst comes to worst, I have a spare radio that I own personally. I'm willing to donate to the station to replace the one upstairs.
So the question is, he's going to program both tones, Natalia and Devine, in all the units.
So as of right now, the county is supposed to use one set of tones for our district, because I told them we are one entity. We are not Devine and Natalia EMS. We're one EMS agency. So please pick one tone and use that tone. They identify us by Station 40 and Station 41 being Natalia. So they push the tone. Station 40 means it's a Devine call. Station 41 means it's a Natalia call. Sometimes dispatch gets busy, they forget, whatever their excuses are. Sometimes they still push the Natalia button. So I've asked in this quote that they program all of our handheld radios, the station radios, as well as all the vehicle radios, to alert, when we set the channel to alert, that it will pick up Devine and Natalia tones. So it doesn't matter what button she pushes, the SO, it will still alert our radios.
So one of the things with the newer radios, since it's 2025, smart of it, anyway, is that they can actually program one of the buttons, the side buttons on the radio, to go into private call. You don't have to go roll it to a channel and then roll it back to be able to communicate. So
it's a function, yeah.
Right, that's the function that we want. So with that, to help them get a good night's sleep, I make a motion that we go with Alamo for $1,750 to reprogram our radios like they should have been done in the first place.
Do we have budget allocation for that?
We're going to move budget from another line item for that. I'm going to zero base the budget. I'm not going to just grab looking for money, but that's my game plan. And if you want to meet with me after I decipher that and figure out where we're going to move that money, here, I'll be glad to do that with you.
One of the things, if I'm correct, I haven't heard anything different, was that Christie's position was budgeted at 25, yet she had a contract for 11, so there's 14 right there.
Right.
Okay.
But we're still concerned about your initiatives on the 65 and the disabled.
I want
We
to
ain't
vote.
got there yet.
I know, but I'm still, that's upmost in my mind as well as we're going through this.
I have a solution.
All right, well, then I'll second your motion, man. Go, take care of these guys.
Okay, so I have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Unanimous. Item number 11, review, discuss, and approve garage door proposals.
So this quote,
Explain to us how we got there.
Or why we are there.
I'm sorry, I can't find the quote in my stack of 4 papers. So, the reason we need to get the garage doors fixed is because as of right now, if somebody closes the door and you're standing under it, it will crush you. They are supposed to be designed with a safety mechanism in place so that if it comes down on a vehicle, a box, a person, an item, that the door automatically retracts and goes back up, and then there's no injury, thanks to workman's comp. So this would be a quote to have them come out and repair that system so that when the door comes down, if it hits something, it actually does go back down.
Those doors are from when we built this station.
Yeah, I know.
I can't tell
What
you.
they do is the sprocket spins off.
I can tell you
That's how
that
it
it
stops.
has come down and decapitated one of the radio antennas. And I'm gonna leave it at that.
Yeah.
There's no more need to know.
So what's our number?
The number is 349863.
It's-
Can I ask a question on that?
Sir, yes, sir.
Is that the same deal where the electrical thing and it's on the bottom of the door?
Yes, they can move those anywhere.
Would it not be more cost efficient and maybe even safer to get the kind that has the beam that just goes across?
So that's the fix.
Oh, yeah, I'm sorry, that's what,
Okay,
they're
that's-
doing it.
That's the fix.
That's about that on my garage.
To put infrared sensors so that no matter at whatever point, it'll pick up the ambulances or the vehicles. The other thing that's included in that quote is to fix the lights on the inside and outside of the bay. If you look at the lights, they're supposed to turn red or green to tell you whether it's opening, if the door's moving or
Those
not.
lights are broken.
And it's really hard to see the door when you're in the driver's seat. So you can look in the mirror and you can see a red light, green light, a whole lot easier than you can see a moving door.
I had garage doors put in my ramp.
Especially in the dark and tired.
Right, and if you go out there right now, I guarantee you only half of the lights work. If you happen to give it a love tap, pretty sternly, the other half of the lights starts working.
So this quote is from Garage Gurus, it's the second quote. The first quote was from Texador, and it was near $5,000.
Yes, it was over $1,000 savings.
And this will solve the safety issue.
Yes,
Yes.
and they'll come out if the doors don't work.
Warranty,
Yeah,
work warranty. We're not replacing any of the motors, we're just replacing some of the
They're,
Safety
sensors.
yeah, they're just adding the infrared sensors and then replacing the lights.
fixing the light situation. Okay.
business, got
No,
left.
I'm with you. I mean,
If I would have
this is the
known, I
crap
would
that I
have
crawl up
gone
and
into
do,
the
but I
garage
ain't
door
going
business.
there.
I make a motion to approve the quote from Garage Guru for $3,498.63. Again, that's a line item that I'm gonna have to go grab money from because it wasn't budgeted.
So I'm about to let it turn. Okay. I'll second that.
Okay, so I have a motion and a second. All in favor, say aye. Aye. Opposed, same sign.
Okay, so before you move on to the next item, Tony, what I found out when I did a building walkthrough from Jason is that the generator, the $25,000 generator or whatever y'all paid for that thing, it doesn't work.
It's not.
It does not come on. It's supposed to do a monthly or a weekly test, and it does not do that. And we don't have a maintenance agreement.
There is no service agreement on file or record that I have found or been able to produce.
That's all we have.
And in my previous experiences, all facilities that have generators should have an annual
Yeah,
service agreement.
it should exercise.
Yes,
Yes.
so
And it's not doing it.
most emergency services, hospitals, critical infrastructure, they run their generators for 1 hour a week.
Now you put on the load.
Yes. So my recommendation is that we look at the generator agreements, which I have 2 quotes.
So where I'm going with this is that, honest to God, this qualifies, I think, as an emergency situation. It's $650 to come out and look at it and to make it work.
Well, the $650 is gonna be the service call, but then
Right, if they find broken stuff, it's gonna be more.
but this should be in, how old is that thing?
Don't know.
We bought it in 2021, but we didn't take delivery of it till 2022.
So in theory, it
right?
should still be in a warranty, I would assume. Can't be over hours. And-
Probably a 1-year warranty. Did that warranty item in there?
Can't find anything on it.
I can't find anything on it either.
I thought you found a book for it. It didn't have a
It's an
company.
operator's manual.
Even in that file?
We don't have an invoice or anything from the company?
Have you checked with the point of origin, the place that bought it?
Yeah,
I
that's
don't
what
know
I'm
where it
saying.
came from.
It came from that place in Poteet.
They never responded.
Oh, I was right, I sent it to the place that it sent. It was, you'll have to ask Juan, because it was Juan and,
Billy.
Billy's. Dylan.
I'll call Billy tomorrow.
So we'll table it and see if it's under warranty.
Got it.
Well, it wasn't on the agenda anyway, but just to so y'all know, the generator doesn't work. So if we lose power, they lose power here.
It's come on every time the job lost power.
And the last time we knew, we're sure, was when the city power went out and we still had power.
Okay,
I don't
so,
know how to test that system.
yeah, we looked at it and it's all electronic in there and I was like, I'm not pushing it in these buttons.
You're gonna have to become extremely smart with generators. I'm sorry to say that.
Okay.
One way that you could test
I'm not foreign to them.
it is go out to the main box and turn the switch on.
Hit the disconnect.
Saw it come on.
Hit the disconnect.
Once that
it should
switch is
power up.
on, it's supposed to kick on
I'm assuming that's on
the
the
generator.
machine.
Yes.
That would be my recommendation because
Is it,
I know that we've lost, because you'll see lights go out around town, and then whenever it snowed, not this time, the last time, but everybody lost power, and we didn't even see a blink at the time. So the assumption is, and it's quiet, you never hear it running.
yeah, because it's a
And I never
natural
hear
gas
it
generator.
test. And the few times that I've seen it test, you get, and if you're paying attention, lights will flicker for just a millisecond. But I do know that it's worked in the past because we've lost power in the surrounding area.
Let's go test it. I got some dippers. We'll go.
I think you can honestly go out to the box.
Can we get a crew on standby?
And shut it down. And that should, it's supposed to kick on the second it loses electricity.
Okay.
And that's the best,
Oh, yeah, just
best I would
coordinate with
do
the
if I was you.
Huh?
Coordinate with the crews if you're gonna do it, or do it when they're not here.
Well, you can program it to run on that.
So, no, what he's saying is tomorrow,
Test it.
I'll come over here with you and we'll flip the breaker and
You're not, it's not gonna work with flip breaker. It shouldn't work. If you flip the main, if it's wired properly.
The
it
only
should-
reason I have it is because I don't want us to be liable for something to happen. I don't want to give them a reason to say, no, you voided your warranty.
yeah, I don't think that will happen, but anyway, okay.
40K.
Move on, sir.
That's a big generator.
All right, so
It's a 40K generator.
review, discuss, and approve payoff for AT&T devices.
So when Pat and we all met that day, Pat was talking about the different devices. So currently we have two separate bills, one for the EMS stuff that we purchased, which is the 2 tablets and the 4 cell phones, is that correct? Then we also have another bill, which is the 5 tablets that we currently have. So for us to move forward, like Pat wants to move to FirstNet, we have to pay off the current
Contract.
tablets and contract to move to FirstNet.
Okay, what's the number?
Stand on.
This one?
Yes, this one. I don't know if you can see it, or if you have it. I don't know. So these are the 2 separate bills that we have.
So
So the total amount of payoff
total
is,
payoff is 5,000, and what's the new rate gonna be for FirstNet?
we won't know that until we move to FirstNet. But
I paid $50 a phone.
50 bucks a phone. Okay, so right now we're paying how much per phone?
It's plus the phone plus $40 plus $10 or something like that.
So our AT&T phone bill,
Our service is what right now?
This bill right here is $700 and something, and this bill is $300 and something. But
Okay.
with that being said, I'm asking the board, I'm coming to the board, I would like to take
Yeah, right,
possible responsibility as far as for this tablet.
Yeah, I'm tracking it, yeah. So when you take that one, are you gonna take that one along with the balance and do it on your own?
Yes.
So we don't have to worry about that one's gone, potentially?
You minus it.
And then-
So we're gonna have 1, 2, 3, we're gonna have 5, 6, 7, 8, 9 accounts at roughly 50 bucks each, is that what you're estimating?
And you can remove one of the phones because she's not using it. This one,
This one right here, this telephone right here.
For service,
I'm
but we
not
still have to
using
pay
it.
for it.
you still have to pay it off, but you won't.
Once you pay it off, then you don't have to do the service, so you can delete that one. This one right here are the 2, currently are the 2 phones that we had for the EMS units, you are not using, but you do have to pay it off. The only one you have to pay for is the EMS director, his tablet, and then your tablets. Then you'll have to decide what you want to do about that 5th tablet.
Well, what kind of disposition can we have for those phones? What's our option for them? If we're not going to use them, they're iPhone 15s are brand new. So what's our options on those ones?
Well, once you pay them off, you own them, so it's.
I hear what you're saying, but what's our options? Can we sell them back to to AT&T? Is it, what's that?
I can ask that question, but my recommendation to you would be is to save one of these phones, because if you're really truly, which is the discussion we had, getting rid of the fiber, your fiber currently has three telephone lines, plus the fiber is upstairs. One of those telephone lines is the station phone. So you can always make one of these the station phone and get rid of your landline completely. That's just a recommendation.
That's an idea.
I'm not opposed to it. I'm trying to figure out what's the,
Monthly, what are we paying to
yeah,
AT&T?
what are we at now and what's
Because I've got this-
what's that number going to be? What's the delta in the number? What's the difference? What are we going to see? So if it makes sense if we're paying, what did we say, $79 per line for service right now, and we're going to reduce that to roughly 50.
So the top one, you pay $694.23 for the top, where the cursor is at, and then the next one is $327.51 for the second set of phones.
That's a monthly.
That is monthly.
That's for service.
That's for service and everything that comes with it. Now the tablets, the only thing I can tell you about the tablets that you currently have that is a benefit, I don't know for FirstNet because I don't know much about FirstNet, this is unlimited data. So that doesn't mean if you're on the side of the street, you can still use it, it's unlimited data. I don't know if that's what you get with FirstNet, I'm not familiar with FirstNet.
Yeah, that's what I get.
Okay.
I get it, I have a mobile hotspot, so I don't need anything with my tablet because I use my phone as my mobile hotspot.
So you just really have one phone to get rid of? If you keep the other phone?
I'd like to know, like, we can, the disposition on that phone, can we recoup costs off of it? And then, and really, it's again, it's a matter of it's the difference. What are we paying now monthly? What's the payoff going to be? So there's going to be a payback period for that $5,124. So what's that payback? How long is it going to take us to recoup that cost? By paying, so if we're right now, if we're paying $79 per line, right, on each of those. I don't know what that number is. I'm just making that up. If we're paying, let's say we're paying $100 per line on there, and it's going to take us down to $50 per line for FirstNet. Great, awesome. Well, that's going to net us out. You know, what do we have? What did you say? 8 piece or 8 different whatchamacallit services that are going to go down. So the 8, that's $400. If it was 100, now it's 50, so it'd be $400 a month savings. So how long is that $400 going to take us to pay back $5,124.27?
Plus, if we take one of those phones and make it the station phone, then we don't have to pay that $2,300 a month we're paying for fiber.
We pay $2,300 a month for fiber?
Yes, sir. $2,300 a month for fiber.
And then we just found out that we have another
It's
bill.
no Vaseline.
Yeah.
No.
What the?
And
Elon's $140 or something?
and there's 3 fiber lines, so there's $2,300 plus there's another charge for the 3rd line, right?
So we pay for the fiber, which is one bill. We pay for the phone lines, which is another bill. Then we pay for service for having the fiber upstairs and downstairs. It's 3 separate bills.
And I think the total is like $3,000 something a month. So
your machine, these machines need to be on Wi-Fi, I'm sure. Are they on Wi-Fi?
But it gets better. They had to pay for fiber to be put in here,
Installed, yes.
which was not cheap.
So where the fiber came from was we had regular AT&T, which I recommend that if you don't go with Lifelink, that you use Air, AT&T Air, which is only $60 a month, and it's amazing at my house. I don't know on this side of town, but it works amazing. But the problem was we had an upstairs and downstairs internet, and it just was not have the gigabyte. So somebody came to the board and asked the board if we can upgrade our internet, and that's where the fiber came in.
So with Starlink, it's $140 a month, and it will give you smoking.
I got one at the house, I got one at the ranch.
And I'm not familiar with stuff, so I
That's
think we need to do
that's
that.
our recommendation, to go to that.
So if you want to look at the numbers, what totals we're talking about?
It's just the dang fiber alone.
Yeah.
And is there, well, hold on, do we have any restriction if upstairs that are on Wi-Fi? Because it's for personal, when you guys are up there, you guys use it at all?
They do have some devices on.
I mean, somebody, so when you guys are hanging on there, you have a TV or something on it, or an iPad or something, you know, we watch TV up there.
We have TV up there, but
It's not, when it's not on your Wi-Fi.
it's on Allegiance's Wi-Fi.
Why do we have Wi-Fi up there?
That's a question if you want.
Allegiance, y'all have your own up there, Pat?
We have to be able to clock in and out.
The service we had before was poor, and ESD was paying, I don't remember how much money, but it was worthless, and we were paying for 50 gigabytes a month, and we're only getting 4, or per second, whatever that is.
Yeah, whatever that, yeah, I got you.
We moved over upstairs to the very same service.
We have,
So we have,
Y'all have Starlink upstairs?
no,
No, it's a FirstNet wireless card up there.
so
we bought FirstNet.
You guys are good.
Yes.
they did have a slowdown recently. The blood that they carry is monitored from STRAC. STRAC was on Allegiance, not in a good way, because their readings weren't updating. So they asked if they could put their blood transmitting device on our internet so it's more stable.
Sure.
Which we did.
Starlink will take care of all that.
The unit phones and their tablets they use for their reports are also on the router. That's it.
But none of our personal stuff is.
None of their personal devices are on our
If it
Wi-Fi.
doesn't belong to Allegiance and it doesn't belong to you guys, it's not on y'all.
So is there any legal restriction for them to be on, if, let's say we transitioned over to Elon, and is there any restriction for them to be on our the systems? I don't anticipate, but is there something I don't know, we don't know that?
My only recommendation would be is you keep it as a separate router, just like it is right now. We have an upstairs and downstairs router.
I would say
One
if
service, 2 routers.
I don't even think you need that.
I don't know.
It won't buck down your router, but
they're absorbing the cost though, it doesn't matter. But I would think that if their router goes down, they can hop on ours and do whatever they need to do until their router goes back up.
The original agreement, I don't know if it's in the contract now, but the original agreement was that ESD provided internet services. The reason we changed was because the system that was upstairs was so slow we couldn't get our work done. So we took it on ourselves to go purchase this FirstNet thing to improve the...
So are you guys starting, was that part of the renegotiated contract that you guys get paid for that?
No, we didn't bring it up, we just did it.
It's not in the
So you're talking about cutting $3,000 a month.
Well, we're getting awful close to $50,000. Okay,
The only
good.
thing that I recommend is that before you do the fiber and cancel the fiber, that Jason tries to find some different kind of fire alarm system, because your fire alarm system has to have digital phone lines.
Here's my
If
deal
you're
with
gonna keep with
it.
it.
So
Throw that out
they're
there.
worried about the fire alarm. You have sprinkler system and you have smoke detectors in the building. The fire alarm is just the reason that they're paying for fire alarm system is just because it's monitored.
which we don't need.
Which if your sprinklers go off, there's a stationary system that sounds an alarm here, correct?
Yes.
Yep.
I'm going to assume, but I think the monitoring also contacts the dispatch, because I've been contacted 3 times because of...
Well, either they'll call or the neighbors will go, hey, your building's on fire.
you have insurance on the building, right? I mean,
Yeah.
But I just want you to, that is one of the reasons why you have the 3 phone lines,
My recommendation is to cancel the monitoring contract.
which will save you $100.
So, I mean, you could see if they can hop on Starlink or whatever, but we're talking about a considerable savings every month if we got rid of just the fiber.
Can the alarm system, I would be opposed to getting rid of the alarm system. Just because there's not always somebody here. But if it's not unreasonable, It seems like if it's not unreasonable, we might keep it, but can that be used on a cell?
In 2025, you would assume that a fire alarm company could go wireless.
They can't. It's an additional $500 a year.
Oh, geez.
It's better than paying for $3,300 worth of fiber.
I can't believe we're paying that much money.
But I think the original question that he had was how long it's going to take to save. You don't have to have the fiber for the alarm though, do you? But you still have to spend it because it's your equipment. You
But
can buy out your equipment.
the contract with the fiber is the 2 phone lines. So if you're going to cancel it, it's going to cancel it as a bundle.
Sorry, I told y'all this is going to be a long meeting.
So my recommendation to the board as being part of it, have Jason look around for different fire alarm monitoring services that will do wireless and compare the pricing between what we have now, getting rid of the fiber and adding the wireless.
We have to install something new, and it's gonna cost us money to do that.
Exactly. Because we looked at this before, and
Yeah.
the current alarm company was the cheapest, and they're trying to sell us their cell phone, basically, just to sit on top of the damn cabinet, and it's another $500 a year.
But you could add, if we could use those 2 phone lines for the fire alarm system, that would utilize the 2 phone lines.
Can you, okay,
I think the only thing you're doing is paying off your equipment, which you're gonna own anyway. The phone line bill individually is gonna come down over a long period of time, so it doesn't matter.
well, I'm
You
looking,
still owe
I'm looking at that one. Okay, we're gonna reduce on that phone line bill, but then the bigger one is we're reducing the fiber bill.
Yes, that's the main.
So how much is it? $2,500 a month?
It's a lot.
Total is over $3,000.
For AT&T, yeah.
You might want to see when the contract is up and if there's a buyout on that too though. Because I know AT&T Fiber, when they put it in, you have to sign a contract for X amount of years and pay it off if you get rid of it too early.
I will verify, send it to you guys when the contract is signed.
So you might want to look at that.
Please dig this one deep. Give us some good options on it. This is insane.
Okay, with that said, then I make a motion that we table this option.
I would second that motion, please.
So we're tabling the payoff?
Pay off that, yes.
Till we know for sure whether we get out of this contract.
Well, I'll.
Does that just mean we take over financial responsibility? Can that be approved?
Yeah, we'll walk down, we'll run all the detailed numbers on it. I don't know what we've got.
What do you think?
We'll run a spreadsheet.
She wants to buy out one of those tablets. Well, I'm good for that.
I'm okay with it, yeah.
Yeah.
Okay, I make a motion that we let Christie buy out. Say what you need to do, Christie,
Any transfer of responsibility?
for one of the tablets, and you're going to relinquish your phone.
Yes.
I second.
So I have a motion and a second. All in favor, say aye.
Aye.
Opposed, same sign.
Steve.
Unanimous.
Longer, bro. I'm gonna be up all night as it is.
3 more. You're thinking about $3,000.
Yeah.
12A, review, discuss, and approve replacing the Apple iPad.
It's government money.
So where this came up is when we had the budget meeting, they discussed that Juan had lost an iPad. I discussed it with Juan at the safety meeting, and he was like, well, if I get a bill, I know, if I get a bill, then I'll pay it off. My thought is, he officially hasn't discussed, I don't know what he has done, is that we file a claim with VFIS for the $1,200 or what was it, $1,200 for the lost iPad and see if they pay. If they don't, then my personal thought is it's his financial responsibility.
I second that. Oh, yeah, anyway, so that's a great solution. We have insurance, so run it through them. If they want to cough it up, then great. If not, then we'll come after Juan.
I will send you the information for your contact for.
Motion and second.
I have a motion and a second. All in favor, say aye.
Aye.
Jesus, Juan.
Opposed, same sign.
Oh, these are gonna go fast now. Maybe not this.
You said that a while ago.
Next slide. Okay.
A review, discuss, and approve approval of EMS chief job description with amendment.
So this was tabled from last month's meeting. We had the discussion in our work group. Now I can find my job description.
Yeah, so, I mean, we all know where this is coming from, but I'll review it anyway. This is all about, the potential shift in Jason's responsibilities, should the board approve, from managing people to managing contract. And in addition to that, there was two major components, or three major components on there. This is just my write-up on it. Again, as with before, I'm glad to get more input from you guys on it and understand. I'm agnostic just to the specifics. These are just things that were coming through for me. But really, it comes down to heavy management of the contract, running the maintenance for all of our property and equipment, and then the training. Jason, can you share what we talked about for your training, because of what you have as a unique uniform?
Yeah, so we added that responsibilities, and if someone were to happen to need the preference be that you hire somebody with training background or some training experience as a coordinator. In the state of Texas, there's 2 coordinator certifications, basic and advanced, advanced being higher, which I carry.
You can get the advanced because you're an LP.
Well, I already have it.
No, that's what I'm saying. Oh, you already have your advanced coordinator?
Yeah.
Okay.
And have been for several years. It also, in addition to just holding the certification, having experience with that certification to back it up. And being able to offer some of those resources here internally to our local departments and providers, as far as neighboring jurisdictions also. We'd have the ability to host classes, teach classes, and issue CE credit for those. If we wanted to do an initial program down the road, it is something that we could do. Initial program means EMT, advanced EMT courses. The biggest thing preventing us from that right now is the hiring of a medical director, which I will continue to reach out and get more quotes. I only have a quote from one. That medical director is requesting $1,500 a month.
So, and we would need that medical director in order for you to perform
To have our own training academy, yes.
Right.
The other option would be another agency that I do coordinate courses for, we sign an MOU with.
And what would that entail then for us?
Just an agreement that says that we can work together.
Okay, and would there be cost involved with that one from us, or would it be an exchange of their services for our services, or how would that work?
The biggest thing is going to be name and branding. They want to be able to slap their name on it.
They want to be able to? That's good for them, for their resume and all that?
Right, and then for their organization, the cost would go to them. We would get a portion of the cost, but we wouldn't get all of the cost because they own the program.
Okay.
If we want to own our own program, we need to have a discussion about hiring a medical.
So, Scotia down in the morning.
Ma'am?
He's
Dr. Scotia.
correct, he hasn't responded back to the quote.
So with them, just clarifying here, the discussion with them, if we did that way and they came in, yes, we get a portion, but they assume all liability, they've got all of the insurance, they've got all that stuff.
Yes.
So that's the positive side for that. The other side is that it buys us time to be able to move into that direction.
Should we want to, yeah.
Yes, and I think that's a long-term discussion as we start our 3 and 5 year plan, which we've really got to do.
Yes.
So, you know, I'm good for that. What I would like to see in this is under the maintenance portion, give us reported, you know, how many miles we're burning on these ambulances, and you know, so we know wear and tear. If we're going to keep them, we've got a plan for replacement, because we know that if we're going to replace them, it's going to take 2 or 3 years once you order to get delivery. So those are the things that we've got to start looking at. And we had talked about a plan of doing like an in-house, in-service training with the crews, just so I realize that you're wanting him to move away from personnel to contract.
We can't do personnel.
No, I understand that, but where I'm going with this is that it helps everybody if you just go over equipment and just as a group, just as a group going over equipment and and SMOPs and all of that other stuff. So like an in-house training that they're able to do sometime on their shift, each shift once a week or once a month or whatever he comes up with.
Pat, what's your, you guys for in-service training, how, is that something that would be?
We offer and have offered, we have a Texas CE program certification as well. We have a coordinator and we've offered classes here. It's a great idea in any house, always have continuing education. Now, what we try to do here, because our academy is in Corpus last year, and we are moving the academy to San Antonio in 2025.
Which would make sense.
Extension thereof. So we'll be able to offer more classes to our own employees in that context. But the way we did it last year was I got the agreement from our coordinator to get the certification to do it here. Problem is I don't have enough instructors to do it. So I asked the staff to do that. So it's additional work for the staff because you just don't come in a room and talk about stuff. You have to, and Jason can explain this as well, to have a program where you get credit for it, right? You have to have this all laid out and documented before the fact and approved by the state, right? That is a lot of work. It really is. And so my guys were going like, I just don't have time for that. I said, okay, I get it. It's just an offer. Hopefully next year we'll be able to do more of that, but I think it's a great idea if you guys can do that because everybody wins. And Jason has the certification. He can reach out not just to our staff, but to fires and Natalia. I mean, there's surrounding communities that will probably like to enjoy that program as well. But everybody benefits.
I think that there's a two kind of in my mind there was a two-part benefit. One would be to again all of the Medina County crews that they could be brought up to a higher level of training and be able to provide better service in the community. And that's in order for us to say, okay, we've got an asset that we want to maintain and we want to be able to use that asset in order to provide greater training for the services in the county as a whole. We would have to work out that as far as not compensation, but just coordination on those pieces. But I also saw it as a potential to have certifications for outside agencies that would come in for, I don't know, for a period of time, and then they would actually pay for those services in order to meet those checkbox.
Because there's a lot of certifications that are out there that are above. These guys go through school, so the CE program typically is an enhancement, just as a reminder, it's something you already learned, to just practice, right?
Yeah, absolutely.
And so that process there, the one that you're going to get, in my opinion, a lot of outside firms, is folks that want that and can't get it at their current place of employment. And then they're always trying to find places to get ACLS and PALS and those other certifications that aren't mandatory, but most employers want you to have it. So you have to go somewhere and pay somebody for that certification anyway. So if he has that, the coordinator stuff to do that, I think it's a great idea for the ESD to have that. We can benefit from that as well, but like I said, we're opening up our own academy and we're going to offer all those same classes. But having it here allows people who actually work here to participate here and not have to travel the same time.
So you said you guys are going to be moving this stuff into Bear County to, which makes complete sense because that's kind of your center of gravity now.
Yes.
Is that something that we would be essentially competing, not competing for?
Our goal in our academy is not to, and I hate saying this without my boss here, but the purpose of the academy primarily has been, I want more EMTs. And
EMTs right now are paying anywhere from $2,000 to $2,500 to get that certification.
Okay.
We're offering to pay people to go to class. We pay you while you're in class. We pay for your certification. When you graduate, you work for our company. We've also got, because we're advanced, we're offering our basic EMTs the advanced level as well at no cost. They get paid while they go. And we're also doing the same thing for our advanced to make them paramedics. We benefit from that because we bring our people up and they stay with our company.
Yeah.
That's our academy.
So you're doing initial training, not continuing education?
We're doing both.
Are you?
Yes. But as I said, it all started, down the west, whatever that is.
Right.
And but because of our employment numbers growing in the Bear County area, also Pflugerville and Austin, the companies decided that we need to extend that academy to this part of Texas as well, and others. So I think right now the way the discussion has been that I'll probably be overseeing the academy once that's been put into place. And our goal again is to grow our people and employ people, not to put on classes for the general public and charge folks. That's not.
So my thought was more start off with like a CE program, like 3 hours a month, because as a paramedic you got to have 40 hours of CE every year plus other stuff. And a basic EMT is 40 hours and 20 hours in 2 years. Is that correct?
Typically, 3 hours a month is what you try to go after.
76 hours every 4 years.
And that covers your basics and your paramedics.
Yeah, so a paramedic is 160 for over 4 years, but you have to do 40 hours a year. And that national comes into play and all that other good stuff. So my thought was just to do CE here, just to have hands-on, because advanced skills, EKG and all that other stuff, you lose those if you're not doing it on a regular basis.
When we were going to do our own service, the plan was to initiate a training plan of 8 hours mandatory a month.
Okay.
Minimum 4 hours had to be in person. And we had software, they log in, they do all CEs, all categories, whatever they want. But 4 hours were going to be in person a month.
Yeah.
And that would fall in line if you did the full 8 hours every month for a paramedic, you would meet the requirements at the end of the year for your certification.
And 3 hours you can bring over the fire department,
Right.
so that we're working together, working with crews, because they need a first responder or EMT CE hours also, and so they have once a month, they do 2 fire training classes and then one first responder class, and so you can integrate them into doing what you're doing so that we're together, working together.
I guess my question is this something that we see you guys? I don't know. So is this something that would be a benefit not just to the community here, but is this something we could use to get more training throughout the area, throughout all of the area, the broader area that people would come in and travel for, and stay here for the course, spend the time here, pay for the course. Is it all worth the squeeze of putting a program like this together?
I think that's a plan. I mean, we don't need to decide on it tonight, but that's my thought when you're talking about medical training.
Yeah.
That's where we're moving towards. I would think.
Always looking towards that idea that
Build it and it will come.
if we're going to be dedicating his time to a once a month, we're talking like a week every month essentially. It's kind of what I'm thinking.
It can grow to be a lot real quick.
Yeah, and is that
So it's time management.
would that pay off? I guess is the question. And then how we would have to figure out the financing of it and how to because
It's self-interest for the medics locally, absolutely. It's a huge benefit and asset to them.
Yeah.
If you're looking to make it a cost service line, will you break even? Yes. Will you profit tons? No.
Don't care about profiting, care about paying your salary.
Can we break even? Yes.
And is there enough of a demand for it throughout the area that's going to put somebody here in Devine overnight or whatever it is? They got to stay at the hotel. Check, the economic development piece of it. They're here. They're all the things, and they're getting good training, and we're getting a higher level of training for.
Yeah, I mean,
more medical professionals out in the
it goes back to the future growth plan, right? And what kind of courses do we want to offer? What is required of those courses? Is it specific equipment, hours, training, facilities, right?
It not only needs, it just needs to pay for itself. This is the issue.
Yes.
And so we're not just taxing the homeowners or the property owners here for you to have,
Right.
you to be teaching other people to do this stuff. Right. So I guess it's a further discussion. But I guess let's go back to the job description here. Is there anything else you said? Monitor life cycle equipment replacement. Is there anything else that you guys don't want? Is there issue with this? Do we need to completely table this and come back as a working group session later on?
I think, my thought is that you pass it right now and just agree that this is a work in progress. At least you get something documented and then we can work from this point.
It can always be amended.
Okay. I'm open to that, yeah.
Sounds good.
Your baby. Well, do it.
Jerry left?
Restroom.
No.
Duty calls there. Okay, we'll wait till he gets back and I'll throw up a motion, and then we, for approval on this one for now. And then with the addition of the monitoring life cycle equipment replacement.
Bless you.
Thank you.
And I appreciate the input. And no more personal. It's his job. You back? It's helping his confidence, I tell you.
He's old. It might take him a while.
The water's deep and cold. Inappropriate. All right, ma'am.
Do you have a copy of that so I can put it as part of the records?
Yeah, I'll give you mine. Okay, yeah, he's got that. Okay, so make a motion to accept the revised job description for the district chief as what I've put forward, with the addition of monitoring equipment lifecycle replacement and monitoring reporting equipment lifecycle replacement.
Second.
So motion and a second. All in favor say aye.
Aye.
Opposed, same sign.
All right.
It's unanimous.
Thank you for the discussion on that one.
I make a motion to table the next item because we don't have a representative from the fire department here to discuss the item.
Okay, item 14 is tabled for next month. 15, review and discuss grant opportunities, take action if necessary.
Jason, you're up.
Oh, I'm sorry. Grant opportunities, so I would like to talk to the board about the possibility of reviewing grant writing companies to see if they can help us look for potential grant opportunities that the ESD would qualify for, which would help us in stuff like building a station in Natalia.
And training and all that.
And training and life cycle of radios or other equipment that we may determine at a future reference.
I don't see a problem with that.
No, because the grant people will usually wrap their cost into the grant application, so it's really at no cost to us.
It's a standard 15% administrative fee.
I'd actually like to hold on it. We got a person in the back pocket who can do this for us initially, at least get some initial, and it's my wife. She was a grant writer too. So.
Oh,
she doesn't do it for money.
A little nepotism there? Is that
No, she doesn't do it for money. She just advised and consent on that one. So we'll connect that one. So I make a motion that we table that for now.
Wait.
We'll go ahead.
I think we go ahead and approve it so that he can, so we're telling him to go ahead and have a discussion with your wife or whoever.
He's having, got it.
It's not
okay.
It's so that we can move forward doing that.
Don't call anybody.
we'll make it happen.
Okay, so I make a motion that we approve Jason to go out and look for grant opportunities.
I second.
Okay, so I'm reversing this.
Yeah, sorry.
So I have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign.
Okay.
Review and discuss Allegiance 3 options for the ambulance and equipment. Take action if necessary.
I like option 1.
Which is?
Like the man said the other day, go buy them for what you paid for them and take them off your hands. We just signed titles.
So yes, I forwarded all of you the 3 options from Allegiance's COO, Dan. Option 1 is outright purchase of the 2 vehicles and all the equipment with immediate transfer of ownership. Option 2 is a lease to own purchase. Allegiance will make annual loan payments on the vehicles to the district. The district will retain the ownership in the event the district decides to change providers or restart discussions of operating our own service again in the future. This would prevent the district from having to go back out and reacquire all the equipment at the expense again. And Allegiance would maintain insurance, maintenance costs. Option 3, Allegiance insures, maintains, fuels, operates units at no charge, however, forgoes any subsidy increases during the time that the district's equipment is utilized by Allegiance. So
with option 2, are they talking about if we were to go with option 2, to buy us a year to figure out what it is that we might or might not do?
Yes. So
is he talking about he wants to renegotiate a contract at that point, or are we good till the end of the year and then we can make a decision then?
So they will make our payment on the vehicles as long as they hold our contract. They do the same thing with the city of Mathis. Mathis EMS owns their vehicles, but Allegiance reimburses them or pays the annual payment as long as they're the provider for the contract. That would buy us a year, 2 years, whatever, to do our business plan for future growth with the community input. And then at that time, if we decide, hey, let's just sell them outright, we can. If we want to keep them, if we want to change providers and still maintain our trucks, at least for the next provider, that should lower costs if you want to go out for RFP. Option 3, in Allegiance's contract, they do have an annual 5% potential increase year over year. They're agreeing that there will be no increase in our subsidy of $212,000 as long as we maintain the payment on our vehicles. My recommendation to the board is that you go with option 2. You get to maintain the ownership, at least for the time being. They're agreeing to pay the payment. That's just a recommendation.
So Jerry, the reason I like option 2 is
No matter.
we're at, I talked to dispatch, and last year we had 250 mutual aid calls into our district. That puts us where we really need to be looking at a peak hour unit or possibly a 3rd unit. And I just hate that when Devine EMS was here, we owned our equipment. And the day that we contracted and got rid of all our equipment, we're bound to getting a contract to take care of our equipment or to take care of our district. If we went with option 2, it buys us the contract ends when, in October, September?
It's up for the 2nd annual renewal in October.
So it at least buys us a couple of months to sit and come up with the community and create a 3- and 5-year plan to decide with the community if they really think that we need to go with that. Now, I know that didn't work out well, but however that panned out, I think a lot of the community felt like that wasn't with their input or with their knowledge, and it really needs to be on a piece of paper, a 3-year plan. This is where we're going, and have figured out as much as we can, finance-wise and all of that other stuff. To me, my thought is it just buys us a little bit of time.
You're right.
You know, I guess the only
my
You ain't
my
gotta
devil's
sell it
advocate.
to me, Steve.
No, my devil's advocate on that is it's cleaner if we sold them.
It is cleaner.
It's cleaner and.
But again,
it's entanglement.
if for some reason the community said we need to do, we would like you to move this way, at least it gives us a couple months to come up with a plan on a piece of paper instead of an idea in our head. And then at negotiation time, if we decide we want to do Allegiance or whoever, then we can look, if that's the way we want to go, we look at that. But at least it buys us a little bit of time.
The other thing is it's a bargaining factor, bargaining chip, if and or when Allegiance says, hey, we can't do y'all anymore, we're pulling, or if the board decides we don't want Allegiance as our provider anymore. It's a bargaining, it's a negotiating tool to the next provider. Well,
we've already got ambulances.
We've already got everything.
Okay.
All you gotta do is come in and staff it, right? So.
Yeah, okay, I understand. It's just the cleanliness of the.
Yeah.
We don't have to worry about that anymore. It's no longer hanging over.
I get it, but
all that.
When we had Devine EMS and we got rid of all our stuff, then we're at their beck and. Jerry, you were gonna say something? I'm sorry.
Oh, okay, yeah. We were not out financially. If we, in a couple of years or whatever, decide to go self-contained, we've got the funding to order ambulances and get them in place. I was just looking at it, like Steve said, we're done. We don't have to worry about them 2 ambulances anymore. And we have the money back to spend on them. This is my opinion.
So what would we do if we got all that?
We're gonna what if this thing to death. Make a decision. I don't care. One way or the other.
Okay, I make a motion to go with Plan 2.
Oh, man, yeah.
I don't have a problem with 2.
I really don't have a problem with it either. I guess I'll second that then. Yeah.
Okay, I have a motion and a second. Going with plan number 2 for Allegiance equipment buy. All those in favor?
Wait, can we add in there that you're giving Jason permission to have this discussion with
Yes, the board needs to appoint the authority for me to have the discussion and move forward with.
Well, you'll have the authority to talk to them about it, and then next month you'll bring back what has happened so that we can make a final decision on it.
So amended. Oh, sorry. Yeah.
So I have a motion and a second. All in favor, say aye.
Aye.
Opposed, same sign. Review and discuss the Natalia property, take action if necessary.
We got to you.
All right.
Hallelujah.
It's a long meeting. So I had initially said in previous board meetings, I don't have it with me. I would like to discuss the possibility with a subcommittee to include the Natalia Council or community members, the possibility of doing a metal building kit. It's significantly cheaper than going out for RFQs for an architect. There was some miscommunication and guidance in previous meetings by the previous board about we had to go out for RFQ for an architect. That's not 100% true. You have to go out for RFQ if you're going to do a ground up build. If you do a metal building kit, they're all pre-engineered. So the law states that as a government entity, we have to either go out for an RFQ and have an architect draw it up, or it has to be done by a structural engineer. All the metal building kits are done by structural engineers, and they come pre-approved at whatever ratings, category 3 hurricane, whatever the building code standards are.
My question would be, to shorten the discussion, do we have to use that company to put them up?
No.
Good.
So there are
several local folks here that know how to put up metal buildings.
Yes, sir. The other option would be, we don't have to do a metal building. I don't see anything wrong with the building that we have. My suggestion would be something similar, maybe a little smaller. The reality is, the crews would be happy with a trailer or a single wide and a carport for their ambulance. That's the reality of it.
To me, though, if you buy, the problem with buying a trailer is, 1, we're buying a trailer, and 2, when we go to sell that, you forget it. You're going to be lucky to get somebody to haul it off the property. San Antonio does that, and they stay in these trailers that are there, and it can be done. It's cheaper, but you spend $60,000 on a trailer, you can spend
Not more.
whatever they are, right? Unless you go get a FEMA trailer, but I mean, you could spend that money into a building. So
Why don't we table this until he meets with the folks from Natalia and decides on what kind of metal building kit they want?
We'll bring some alternatives to options.
I'll join him on that. Yes, sir.
Just food for thought. Just food for thought. One more option that you might consider. Why not look at the possibility of just a house?
Moving a house on there?
We have a donated property location that's vacant. But we would need to put a structure of some sort, something on that piece of property.
Okay.
As opposed to, yeah.
That's an idea. So we'll look at all kinds of ideas. I'll join you with that.
What did the heat map show us?
So, yeah, so the 1-for-1 call volume, it's not in the city limits, but it is in the Natalia area.
Okay.
It's the north, east, and west of Natalia.
Okay.
Can I say something?
Please.
So it would be beneficial.
I'm
Come on, Darren.
as this, because we've all been in the account for 20 years. We've busted our ass to help this ESD from day one. We have made promises to people. We've all got mold on promises. We've got to been through committees. We're offered $250,000 for stuff, y'all. We're giving everything we can give to you, prime property, okay? We're helping you with your bills. We're doing what we can. We don't have much time left for this council, all of us old people have been there 25 years. Well, you do. But again, we got to go home and meet these people. And a reinvent the wheel, I know y'all are new board and I appreciate that. But y'all pass forward and prove stuff. We've gone through this program before. You know, we want to help. But it's time. We cannot sit here and wait another year, 6 months. It's already been a year and a half. I mean, this thing's already been developed. So, again, we're not for a big building, but all we ask is do something for our community that was promised us. We worked hard to help everybody to do what's right. Okay? You can look at wherever you want, but the protection for this place, the ambulance, the police department right beside it, the police department's right there to protect that with your medicines and all the stuff's in the ambulance. Your guys can go to sleep knowing that they're safe. Okay? All those things are there for y'all. But we keep passing this thing down another 6 months, another 6 months, another 6 months. People are getting on our ass. I'm telling you straight up. Our system's tired. I'm going to tell you, if this thing doesn't go through, I'm going to say it for me. I know you're past mayor, I'm past mayor, these guys here. We need to get our systems to Natalia and have a citizens meeting and let them know that this is enough. 17 years. I think we all get community involved and say, hey, if there's a committee, it don't need to be us three or our council. It needs to be our citizens of Natalia and the surrounding area. But we are giving you everything we have, more than what we have to offer anybody else. Our fire departments want that property. We didn't give it to our fire department. We didn't. We appreciate that. But we need an ambulance. We need things like this to help. So again, all I'm asking you is just, I don't say shit you off the pot, but do it. Do it. If you need help, let us know. We'll help you. If you want to lease it, we'll build it. But let's do something for our community. I'm tired. Our people are tired. And your guys don't deserve to sit on a damn recliner and sleep in a recliner somewhere. I'm sorry. It's wrong. It's wrong. So we got to appreciate what you do, but it's time to stop sitting there playing around with committees and funding. We can work this out. Y'all have money. We got money. We'll figure it out.
The problem is that whoever made plans, there's no dollar figure sitting on the table of what we need to spend. So that's what we're not saying no, as I told you the last meeting. We have to find out how much it's going to cost. Yes, you're right. We have money to do this. We want to do this, but I don't know what happened previously, but as a board member, I can't write, as you know, you can't write a blank check. You got to know what it's going to cost.
Research. We can hire an architect. We can do all day long. And these things are going to draw them up. You know a building. It's not a big rocket scientist type of building. These things can be built in 6 months.
I understand, but we don't have a dollar figure.
I thought there was a contract that had already been.
It had been approved.
It's already been approved by both boards.
Yeah, but that
supposed to be the ones that put it together to bring it forward.
I've read this contract, and I understand, and as I explained to you, once we sign the dollar line, we're in a 36-month time frame. We don't have a dollar figure as to what it would cost us to build a building on there. That's all we've got to do. So we're going to make a committee and move forward with this. It's not that you heard the discussion. We want a place over there for the unit to stay. Y'all have offered a place. All we've got to do is finish our side of the deal and figure out how much
So it's on you and not on us.
Yes.
I agree, it's on y'all.
Okay.
No, it's on us. It's 100%
So
on us.
then, what's the timeline going to be on?
As soon as we meet, we can find out. Next month, we can discuss the cost of the building, and we can move forward.
At the next meeting, I'll give 3 options, price options of what the building would
Is
cost.
it going to be up on top of the agenda, or are we going to have to wait till the end?
I don't get to pick that. And I'll present it to the board, and vote to make a decision.
Yeah, but again, we use this last, I'm not trying to be rude, I appreciate guys.
No, I understand.
Well, we were here last time with the same issue.
Right.
And I'm gonna be here every month afterwards. But again, it's time to start bringing some people in, and a lot of them.
Oh, and like I said, y'all have been paying taxes for all this time.
Right.
You deserve to have a unit over there. It's going to happen. This onus is on us as this board, not on y'all.
Well,
You made the offer.
It's the whole community. It's not just you, it's all of us.
Yeah, but it's on us to make the financial decision to do it.
Right. But again, we don't have time. We don't have time. We've done crossing bridges, it's like 17 years. If we don't discuss this.
You have our assurances. This has got absolute top priority for us. Okay, please understand.
I appreciate that. I appreciate it.
That we know the gravity of what's going on here, and we want to take care of you. We want to make sure we appreciate the citizens on that side as much as over here.
Well, again, our commitment as council members, and we've done it a long time, is based on us all being together. But in 2-3 years, we might be like y'all. Y'all keep changing boards or whatever. People change. Things change. Right now, we're consistently been at this for years.
So the other piece you have to understand here is we inherited, we did not inherit a strategic plan of any sort.
Zero.
So that's where we have to come in. You guys are on top of the list for that. As that 1, 3, 5, 10. We don't have that. We don't have a vision. We have not. We're new with this. We don't have a vision. We haven't come together and said, here's where we want to go.
After all these years in the community, you've lived here forever like I have.
No, I'm not.
Well, I'm not saying. Well, then, when I was elected on council, the vision set by the public said, here's what you want, council member. I swore up, I'm going to hell this to you. And so the vision has to be immediately. It's not what somebody didn't leave me because I never let me get a pile of crap. But I got to deal with what I can deal with and move it forward fast.
Yeah,
and again,
but we got to understand we have nothing to build on yet. So we're putting the airplane together in flight right now.
Right.
You Southern analogy sound familiar there, Snake Eater?
And to be fair, right, 6 months ago, our vision for the future was vastly different than what it is today.
And we understand that completely. We understand it.
So I assure you that this is a priority. That's why I spoke about it earlier. We talked about the...
All I hope is for our community and all of us taxpayers that this money get put to use somehow, somewhere, not for just our citizens, but for the workers and everybody. To get this over with. It's not getting better.
Darren, by the next meeting, we ought to have some word on grants. We ought to have a design on a building that people from Natalia and a couple of these folks up there decide on. And then, I don't know what grants.
Grants 3 years. Our community center still getting built. It's been approved 3 years.
We're not, but the point I was trying to make is the next meeting we'll have something that we can look at and move on.
And I thank y'all for that. Again, I'm not upset at y'all. Maybe my passion's a little different. Okay, come across. That's because I love it too. Okay, it doesn't come across me. I hope it doesn't.
Not everybody knows you there.
Right. And I appreciate that. Both of them probably full of shit. You know? But it's not in anger. Okay, it's I care about it just like these guys care. But our time is running out.
Well, it's not in anger, it's in frustration, and I 100% understand the frustration.
But
You've been promised some stuff. So what we're gonna say is, we'll put you on the top of the agenda next month, and we'll have figured out what we're gonna do next month.
And that's
I can make that promise to you.
Thank you. Thank our community, not just us, but surrounding our area. We're all the same. We're the same.
And hold on, give that.
I have him at the top of the.
Thank you.
Thank you. I have my citizen comment.
Appreciate it. Thank y'all for
Thanks, guys. And thanks for the passion.
All right, y'all be good.
Hey, Tommy.
All right, you're up, Jerry. Oh, I'm sorry, go ahead, sir.
Number 18, consider and approve adoption of general homestead exemption.
My turn, huh?
Yes, sir.
Okay. Well, at that mind-numbing seminar I went to this past week, which, there was a couple of sparks of interest in there, but not many. They did not mention anything about homestead exemptions. They talked about, helping the community and all this other stuff, until I went up and talked to one of the instructors. I said, well, how do you get support from the community? You got to give them something back. And we're fixing to go out and, the idea is to have a self-contained EMS service here. And in order to do that, you want to get the community in here and you want to get them involved. And one of the big lines you're going to use is, we're going to save lives. I think what we need to do, and like I expressed it last time, is we need to offer them something. And a homestead exemption is a way to do that. It's not a whole lot of money until you come down to paying, January's tax bill. Then you look at it and say, damn. But anyway, I sincerely think that we need to, as a board, put in homestead exemptions. Because there ain't none there. And I did the figure last time. I don't have my notebook with me, but I told you that it would probably affect the budget $61,000. Well, we found 5,000 here and 2,000 here, no problem. I think that if we pass this homestead exemption and know that we need $61,000 next year, we will enter the budget cycle with that in mind. And if it comes down to it, and we have offered this to the people, and say you need to go up on the taxes a little bit, then they're getting something and we're getting something. So you're getting the community involved and you're giving them something. I know it doesn't apply to some of you in here, but some of us are 65 and over.
Well, the homestead applies to me. I just filled that paperwork out again and sent it in. So yes,
I did too. So that's my thought on it. If we're going to ask, and we're going to ask the public to give us more money to fund this $2 million enterprise, at least that's what it was last time, then we need to give them something. And I think that as a board, we can find $61,000 with no problem. I can find 55 right now.
What's the payment on the vehicles?
67 and some change.
A year?
yes.
67,000?
Plus you've got.
Did you reduce it?
Yes, but I can tell you that we're under our expected income. Our expected income is 905.
Okay.
We have on the budget 750 or 782 is the expected income for the year. With sales tax, you're 800,000.
So we're
$100,000 under what we're expected to come in collecting of taxes.
Okay.
That's your payment right there. 67, 199, 69.
That's just for the ambulance. That's not the equipment. There's two other leases.
Yeah.
There's a $23,000 lease on the Zoll monitors, and then there's a $4,000 lease on the.
And all that's going over to Allegiance. Is that correct?
No, just the trucks.
So what do we do with the Zolls?
So that's if we
Insurance?
the Zolls are ours no matter what.
What?
The Zolls are ours no matter what.
Okay.
All that equipment, no matter what happens, even if we sold the units, we'd be stuck with those and stuck with the lease.
Then strikers are paid off.
What's that?
The
strikers are
stretchers.
paid off.
Okay. So we can't recoup any of that cost?
No.
Sunk.
but we get the 67,000 as you just pointed out. I'm with Jerry, let's do it.
But we're still 100 under.
That we're gonna collect, allegedly, we're gonna collect 100 more.
Oh, we're 100 over.
Allegedly, we're collecting 100 more than what we budgeted.
Okay. Okay, I thought it was the other way around.
No.
So I think the vehicles right there just pay for the homestead exemption then. Am I wrong? Did I miss them?
No?
I had another option, but I'll hold that one in.
He's rethinking the rethink.
Bake sale? Bake sale?
No.
So Jerry, are you still at the 20? Is that what you're looking for?
I'm at the 20 for the general and an additional 20 for 65 or over.
So we're on the homestead. I make a motion that
Hey, wait,
we...
time out. Just a minute.
Okay.
I did the figuring last time, and it was $61,000 and change.
For both.
For both, yeah. Because somebody asked me what the impact would be on the budget. Well, we had 4,567 homes, and of those, 900 and something were 65 and over, so I did the math with the tax rate. But I do believe, Steve and Pat and Tony, that if we were to do something like this, and then bring the public in and say, hey, this is what we want to do. We want to build a palace, and we want to have 47 ambulances, one on each block, but we're going to raise your taxes, 0.5% or something like that. I think they would probably swallow that a whole lot easier if they knew you were giving them something back.
I'm with you 100%.
And that way I don't have to, if we're going to be able to do that without my solution, well, then I won't voice my solution.
You voiced your solution.
No, Dave,
we went with number 2. We're getting 67,000 a year back. What's your other solution?
None yet. I will bite my tongue on that and bring it up later if I need to. But if everyone is in agreement that we should.
So what you're saying is, when we have a $20,000 shortfall, you're gonna be able to, oh, here I got it.
Let's say 51,000.
Okay.
But anyway, if you want a motion, I'll make it.
Please do, sir.
Okay, I'm gonna make a motion that we approve adoption of a general homestead exemption in the amount of $20,000.
I second that.
I have a motion and a second. All in favor say aye.
Aye.
Number 19 is...
Along the same lines, I'll make a
Exactly.
motion that we adopt or that we approve adoption of an over 65 or disabled exemption in the amount of $20,000.
Now this, just to clarify, it's not 20,000 for disabled and 20,000 for 65. It's a total of 20,000 for either 65 and or. It's an and or.
Or. 65 or. Yeah.
Okay.
My second.
Have a motion and a second. All in favor say aye.
Aye.
So both of those pass. Congratulations, Jerry. Review and discuss and approve ESD bylaws.
What bylaws?
Can we do it?
It's this one that you presented me, sir.
That's not bylaws.
You asked for the bylaw to be on the agenda.
I make a motion we table that.
That's what I was gonna ask.
According to Ken, we shouldn't do it, but
It's 10 o'clock. You know where your children are?
Yeah, it's past your bedtime, sir.
okay, so we're going to table that one.
I miss gut feel.
The Medina County EMS, Medina County ESD number 4 Board of Commissioners will meet and close an executive session authorized by the Texas Government Code 551 under more than. Are we going to consult with the attorney? Do we have any reason to go into executive session?
No.
Do I need to keep reading that?
No.
Next regular meeting is going to be March the 12th.
March 12th.
7 o'clock.
Be here, be square.
Hopefully I'll be here. No. Any comments, concerns?